Hello, how are you? Sorry, I was so secure that I sent the email and the invitation, and when I was just waiting, like, maybe she's she's late. I will wait, and then 2 minutes. Something wrong. Okay, so
I was like, where is it?
yeah, do you no. Do you have the information, right? Do you have time to see the videos?
The three of
Okay.
them.
What about, do you like it? New information, new words? What's important?
I I love all the trial stuff, so I just watched all the first video.
Mm.
It was really interesting for me.
What's really interesting, the first part is like, you are not sure if you can listen good, but it's a really good way to do a final intervention or this kind of arguments, the way that these lawyers do it is a really good examples of how we have to manage the jury. But I know that is so long, so I just, if you need to see, just see 10 minutes, and then if you want to see everything, it's on you. But yeah, I'm so glad that you like it, because today we will try to do something similar. I am so sure that you remember by the beginning of the course that we do one exercise with migration law, if my minds don't have any trouble, and we do an improvisation exercise, right? So you didn't know how to manage it, but more or less you do it already. So today I will send you a list about some topics. Choose one, the one that you like it, and you will represent in whatever circumstance that you want to imagine, the name, the everything. You will, up to you. You will imagine it and telling me. And this is the list. I'm not sure if you see it already, because I'm not sure if the chat is always on. But if not, I will send you again. You have delay or error in the diagnosis of a patient, not following certain protocols, offering an inappropriate prescriptions of medications, perform a surgical intervention with harmful result for the patient, contamination of a serious infection due to the lack of hygiene in the hospital center, forgetting surgical material inside of the patient, failure to provide emergency health care, on lack of post-operative supervision. You can talk about whatever that you want, any part of the body that you want, any name of the doctor, and etc. And your time starts right now.
Okay. Just give me 1 second to close the chat. And we are ready. You want me to do like my conclusion about the process, right?
Mm-hmm. Um, you need to create whatever that you want to do. If you want to represent the family, the victims, or if you want to represent the hospital, you can do it. It's like on you.
I'm gonna represent, to make some context, I'm gonna represent the family victim. Okay.
Perfect.
Okay.
Perfect.
Well, Sofia was in the Hospital Calderon Guardia here in Costa Rica, and she was getting an operation on her stomach because she was having a little troubles in there, eh, related to the process of eating. So she gets in the surgery room in September 2020. When she was there, she was she has the intervention with 3 doctors, 2 nurses, and one assistant. But the things went wrong by that point because one of the nurses didn't get her gloves in the operation. How we know this? Because we have the evidence that when they get into the surgery room, they have to check mark all the stuff that they get in the surgery room and they don't get a pair of gloves for one nurse. We identify the nurse after that because they have like a protocol when they say what they use in that surgery, what they didn't use, why they didn't need after all, and she didn't mark the glove. So that's where the part of the evidence goes for us to tell that stuff. But we don't have we don't we didn't only have that problem with Sophia. They forgot to close one little window that was in the surgery room when they pass the stuff that they need in case of an emergency. So when they forgot to close that window, sorry, that part became infect the room, and she get a bacteria. So that was the two principal causes of death of Sophia. We have to consider four things that are really important for the case is the loss, the grief that the family of two children and the husband had to pass because it was immediate. It was an immediate death. How do you say immediate? I don't know how to say immediate.
Sorry that I had like the microphone off. You can say it was unexpected death. Unexpected.
Well,
Another thing that I just saw that I am taking my notes is the correct way to say will be of the Sophia's death. No, the death of Sophia. So of the Sophia's death.
sorry, thank you.
Thanks to you. Continue.
Okay, so we have to consider 4 points: the loss of the unexpected death of Sophia, and we have to deal with that, the grief, all the procedures that came with the funeral, the stuff, the impact for the family of losing their mom and their wife, and we have to consider in other three parts the future of the family. We need to consider that they lost their mom, their wife, that the father has the biggest responsibility, and we need to keep it real because he has to work, he has to take care of the children, he has to go with all the expenses, he has to go with all the stuff that carries the children to school, the the racing and all that stuff that that happens when you became widow, right? The responsibility of the nurses, the doctors, and all that staff that is involved in the surgery room. They have to take the
Ana Maria,
responsibility. Yes.
sorry that I interrupt you. Can you please tell
Okay.
to the judge what do you want? What is the indemnization or the
Okay.
amount of money that are you asking for?
Oh, well, I go over there just right now. And well, so when they have to take the responsibility on all the stuff, that's why we are asking for. I just put it right here. $10 million. We are asking for $10 million in moral damages, psychological damages, and of course for the dealing with the loss of the loved one, because we lost a mother and we lost a wife. So we have to put the person that we lost in the real place that it belongs, and it's like a really important part of them. So we have to move along with that, and that's the reality. And we have to make it the better way for the family, and we have to make it real in the way that the doctors and the nurses and all the staff that is involved has to take the correct protocols and the responsibilities that come along with that work. And that's it.
Thank you so much. Okay, I am so sure that it's really hard to see how you can improve in a couple of sessions. But I want to tell you what I saw. First, you didn't doubt about the case. You just, okay, give me a second, you read and you start to imagine the case in your head. And that don't happen in this way at the first time. I'm not sure if you remember your first session of improvisation was so different. Second, you use all the skills from the video. I'm so sure that you want to connect it like from the sentimental way, like it's part of your family, and you take it like all the skills that you just saw, and that is so important. And to get a conclusion. You talked a little bit about the money, but it's always all right. Say, okay, give me a moment, give me a second. I will look important. And with completely peaceful decision, you do your stuff and you give me an answer. I also like the way that you try to explain it, and it's not just, oh yes, it's $10,000 or the number. No, it's for this. You are giving closure to the argument. You know how to conclude. And I guess that this will be the last improvisation exercise. I know that we start a little bit late, and so for that reason, I put a little bit of pressure. But also, when I ask you, I do it like in a really serious way. Like, okay, tell me this, and you manage it so good. Like, okay, just sure, I will go in. Just stop your argument, so you have the capacity to change whatever that you was planning in your mind for a question that you didn't expect. And that is really important when you are doing this kind of exercise. Every time that you can practice by yourself, try to imagine just a hypothetical case, and while you are brushing your teeth, or I don't know, drinking your coffee at the morning, try to imagine how you will defend it, how you will be afford this situation. You know that we need to train our brain for this kind of situation. How we are not connected with these kind of things so constantly. We need to create a simulation in our minds for a start to ask for the skills that we need. If we didn't know how to manage one case, it's really important that we start to see some videos on YouTube and to take ideas by the moment that we are really in this situation. Not necessarily in a litigation process, but also for a consulting. It's really important to have the creativity so open for us. And I really like how you went in a context. Okay, that happened, the infections come from the window, blah, 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 blah. I really like that. And I want to say congratulations and thank you
Thank
for your time.
you.
Okay,
Thank
I will see
you.
you soon. I will see you the next week. Just the direction changed a little bit the schedules. So for that reason, I put pressure in the session of today. But I will keep you
Okay.
updated about what we will do in the next weeks. And thank you so much.
Thank you so much to
Okay,
you. Bye.
bye. Vanessa, hello. Vanessa, hello.
Hello, teacher. Good evening.
Sorry, hello. Sorry that I just organized some schedules like on time because they change a couple of things.
Yes,
But
yes,
I hope that we can do both together, okay?
yes.
The first thing that we will do is talk about the first one. That is the process with environmental law in your context or country. That you tell me this confrontation between the constitution or an international agreement or trade that being again or that have been against one disposition in your administrative sector, an order, a final decision, a sentence, a case, and then we can start to discuss about it. Start to
Okay.
tell me the topic, and I will start to explain you or to do some questions for you.
Okay. Well, the situation that I choose is how the government is was. Well, I think they are already do it, but it was a really big deal during the process, and is the construction of a road could be say like this. Who can cross all the Amazon forest. So it was a really big deal because there are lots of things that we have to consider. but they, well, the government want to do the road, but most of people in Bolivia don't. So it was well, a really big movement because they were lots of groups and organizations who want to stop this situation because they thought that it was not necessary because we have lots of Sylvester life in there, and it was going to be really complicated. And after
Other,
that,
sorry that I interrupt you. Other way to talk about this expression is wildlife, like wild, como vida salvaje,
exactly,
wild, wildlife.
so
Perfect.
biodiversity could be also.
Yes, biodiversity is perfect.
Well, and it was just like that. And well, the first point I want to talk about is the government points. Well, they started to say that we, o sea, in a constitutional way, all of us have the right to have access to all the basic services. And in this case, it was really necessary taking the point of government because most of people don't have any access there. They need a way or a road to move on. They need well, if there is no road, they don't have the chance to give them, for example, gas. I don't know how to say this in English. I think it's the same. Gas,
Yes, gas or oil.
oil, yes, gas or oil, and after that, water, who becomes clear water because the water that they consume becomes from the rivers, and it is not going to really good. And of course, electricity. So they say that it's a constitutional right to have access to all these services, and it's necessary to connect all Bolivia because we are not in the same, how to say that, we are not in the same page because we are disconnected. And after that, and that was the point of view to government. And what was the point of view to other hand? It was that well, there is not necessary because there we have lots of biodiversity, wildlife, and well, we have to take care about it because most of people here want to destroy it, and it is not unjust for make money, and that is not a just really good way to, well, to earn something, to increment the production of Bolivia, just destroying something that is really valuable. Well, after that, most of people say that the communities that lives there in the Amazon, they are not just they don't just need this because making the road and in change all the environmental of that people is going to become in a really change and maybe rude in a bad way. So after that, most of people started to recollect sites and petition for stop the movement because they say that there is a specific clause in the constitution, in the national constitution, that say we have the obligation to respect all our environmental. So in that way, it was not necessary to make that criteria, especially for one thing that most of people say, all the people who was noticed for this situation know, but no one want to talk about it, that is narco traffic. So they want to say why we have really big airports in places where nobody go. Why? And even though we have a really
Chapare.
exactly, and it was going to be exactly like Chapare or Yungas. So uh, people started to think we are going to do the same with Amazon, and this is not okay because we are not contrabandist country. So lots of people want to say that, but there is there is a thing that you can do as simple as that. So
Mhm.
maybe could be just like posts in Facebook and Twitter, or maybe in, I don't know, in Instagram. But you can say this directly as a politician. I'm so sorry, to the government. You can make this like well, you can use this as a really good point to object this project. So this one a really big deal, because most of people don't want to to watch this road, because this is not necessary. Well, after that, I think it was about Tignis. I don't know if you know about it,
Yeah,
because
I listened about fitness. Yeah.
uh, Tignis is a territory that is really protected, because we have lots of biodiversity there, and they were a public confrontation. And after that, well, everybody was analyzing the ecological impact. And in that way, it was really, really hard, because you have two rights. And after that, the government started to make, had decided to make a vote in that sector. So the people who live in Tibnis or near to Tibnis have the option to vote about the construction of the road. But it was kind of funny, because most of people who have voted, they don't even live there. They were migrants or people who started to live in Tibnis or near to Tibnis, just because they are, well, they will work in there. So
Mhm.
it was a really, I don't know how to explain that. It's kind of movement. For example, when you offer some works in a specific area where there is not lots of population, but you give more, I don't know, uh, access or something, or benefits or something like this. I don't know how to explain this. We have this in the laboral code. I don't know how to say this.
A ver, dímelo en español.
En el Código de Trabajo tenemos una cláusula que dice que las personas que viven en, por ejemplo, en las,
Zonas rurales.
no, en las, ¿cómo se dice? En los límites territoriales tienen ciertos
Ujú.
bonos. Entonces, por ejemplo,
¿Tienen
los
ciertos qué?
bonos o accesos
Ajá.
que tienen derecho a ciertas indemnizaciones más o algunos beneficios más, porque muchas de esas personas migran allá, porque no hay gente que quiera vivir allá o que viva de entrada allá. Entonces el
Okay.
gobierno incentiva el hecho de que la gente se
Okay.
mude a los
So,
pueblos.
yeah, you will say they can give you, I don't know, you can say a fee
Ujú.
just by your accommodation or for change your territory in the base of demographic population policy.
Well, and
Son políticas para políticas poblacionales.
exactly. And
So
after that,
demographic population policy,
oh,
una política.
exactly. And after that, uh, well, there are something like this, but they are not really in a legal situation. They are just moving because they are going to find a work. For example, that the
Mhm.
situation of Chapare or for example, Yungas. So they are going to move there just for finding a certain job that is not really, well, they don't was born there. That was the answer. And after that, the votation makes
Okay.
with people who don't even born in that way. So they were migrants. And after that, the I don't know, I can remember the what was the result of that vote. It was really claimed, and after that, even with that situation, the government started to try to negotiate this with the leaders of there, and they make a treat. And after that, it doesn't doesn't matter what was the result of the vote. It doesn't matter any other thing, because they were just want to make the road, and they have ignored lots of right, lots of decision, and especially the right of voting. So it was kind of rude because they are not taking care of our
Natural resources or
exactly
environment.
when resources, and after that, well, they are using some points, ignoring others. So I think in that way, we have lots of problems. And after that, they, even though they do the road.
Listo. Perfecto. Entonces regálame un segundito. Yo te voy a compartir. Okay. Perfect. With this, we are done with the topic of environmental law. And now let me know if you can see my chat. You can see the things that I wrote in the chat or no?
Yes, I think it was this because the other one talks about the, well, the Greenpeace and how everything is going to
No,
be.
no, 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 no. Now in this chat, in the chat of Zoom, you can
Ah,
see what is now texted
okay, I did.
or no?
No,
Or do you want that I send it again?
no, please, I didn't watch.
Okay. I will please ask you that you read these options, choose one, and when you choose one, tell me.
Okay. Well, everything is interesting. Oh, I think for getting surgical material inside a patient, I think I watched already this. Well, some people talking about this, so I think it's happening really, it's really amazing and important. I think I choose this.
Okay, perfect. Do you remember the improvisation exercise that we get in migration law?
Yes.
Did you remember? Today we will do the same.
Okay.
You can choose, represent whatever interest that you want in whatever context that you want to choose, with all the people involved in the case that you want, and basically all the standards that you want to apply and all the behaviors or medical behaviors that you want to explain to the judge or to the jury. And your time starts right now.
Okay. Well, I want to start saying that I watched this. Maybe not in my case, but I know some people that have lived this situation. Starting with a really simple situation. For example, you have a really easy surgery inside your mouth with a dentist, for example, and they have a really straight headache and toothache and something like this, and they started to pass, and the headache is still there. So they return to the dentist, and they find that they are forgetting something inside your mouth, inside your surgery, and it's kind of real. It's truly because you can, well, you can get ill with sepsis. I don't know how to say this in English. There is a general infection in all your body when the infection is in the
Yeah,
blood.
yeah. You can say you get a blood infection by a bacteria. En español, ay, ¿qué día estamos hablando de eso con un amigo? En español, no estoy segura si le decimos hacer, no estoy segura, creo que se dice hay un shock,
Shock.
ahí.
Los, algo así le dicen, ¿no?
Vamos a buscar. Infección,
Well, the word that I know is sepsis, but in English I don't know.
sepsis.
Sepsis.
Bueno, no sabía que se llamaba así, pero septicemia.
Septicemia. Oh,
O
that's
sea,
really
septicemia o sepsis.
okay.
And I guess that is the same word in English
Okay.
because it's a specific name and it's really hard to change. But
Ex-
I want to confirm.
exactly. Well,
Yeah,
well,
sepsis didn't change. Sepsis.
after that, to avoid this situation, most of hospitals have some protocols, some procedure
Mhm.
to count how many instruments are you using, how many cottons are you using, and after that, and after the surgery, before close the surgery, I don't the cut in your skin, they have to count everything, and after that to well being secure that there is no that everything is in the table, you can continue with the procedure. But I think most of people, well, lots of doctors that thought that they are have already do this these surgeries. Well, they think they that they are. I think the day of the day by day, and they are just forgetting this procedure that is really important. And after that, they are forgetting some things that could become in sepsis or septicemia, just like you said.
Mhm.
And well, it's kind of hard because you are putting a life in risk, and a risk that is not necessary just for don't take the well they don't have the procedure that is recommend well that is obligated to do. And after that, well, most of people, I think they have lost their lives because well, this is not just like forgetting something in your desk. It's something that are you forgetting in the body of in the bodies human. So um, I know here lots of people who have lived this, but most of them, for don't say that all of them, don't make any procedure, legal procedure uh,
Mhm.
for this. So they just make a little letter to well to say something to administration, and after that there is nothing. Well, and the correct way should be well make a procedure. So I think it is kind of hard because I don't even know how to say something like this because a medical situation is kind of hard to treat.
Mhm. Yeah, sure. But I want to, like in this specific exercise, I want that you try to imagine a situation like whatever. For example, the doctor leaves a ring in the stomach of my client, and I want that the judge do an examination about all my proofs, and I want to get this amount of money by indemnizations that will cover this. I want that you try to do the whole argument, what happened, the base, the conclusion.
Okay.
Okay, so 1, 2, 3. Your time starts right now.
Well, in this situation, it's really important to know uh, what are the rules that we have to follow in a medical situation. So when we are a patient, we have to well, we hope that the professional that is treating us is going to be a really good way. So we have rules for something. We have rules because they are necessary, and when someone, as a doctor, as an important surgery like this, they are not using this. But in this case, we have to punish this doctor because there is not as easy as forgetting something in your job, because your job is to save lives or to kill someone. And when you are well, when you are forgetting some really basic steps, because those are really basic steps, you are putting in risk a life that even when it was not in risk. So in that situation, this is necessary to take a lot of care, because the patient is going to need another surgery and another pain just for extract the thing that was forgotten. And in this case, I think it is not just for anyone in this case. So for that reason, I think it's necessary to to punish the doctor and all the person who was involved in the procedure, and of course treating to repair the pain that feel the patient, because it's complicated, because these kind of things are not this shouldn't be repeated, because we are talking about lives, because we are talking a service that we are paying. It doesn't matter with this if we are paying a secure or if we are paying with our money, but this is a service that we well, someone's, the institution, the hospital is making us kind of a procedure that they are making us sure that we are going to have some results. And I know there is some things that we are for example, that we are going to be in risk, because all these interventions have a risk. But this kind of mistakes doesn't have to be a risk, because we have rules for something. We have to follow these rules just because it's necessary. And we can leave this doctor just in this way, because this can be and it is not just putting in risk the life of someone just because we are forgetting something. I think is necessary also a punishment, could be an economic punishment for the hospital, just for make a contract with a doctor that doesn't have any, how could I say this, who doesn't have any care about their patients, because we are putting in risk lives, and we are not talking about something that is well, that we can repair as a simple thing that is broken. So in that way, I think it's really important to take care in this way. And of course, to maybe change some procedures, just for make sure that this problem is not going to be repeated for anyone in any situation, because most of mistakes are making because we are not following the rules that we already have in the hospital. So today could be my client, and tomorrow could be someone in your family, because we don't know when are we going to still healthy. And we have to make sure that if we get in a hospital, we are not going to get out uh, mm, I don't know how to say, with our life, because this is really rude, and this could be develop other problems that maybe we are not when we started. So why am I going to a hospital to repair something just for uh, leave the hospital in a worst situation? I think it doesn't have any sense, and we have to work in this. So I think we have to, well, to
Okay,
make a process.
perfect. I want that you please tell to the jury or to the judge how much money do you want for indemnification from for your client.
I think we deserve, my client deserve at least $5,000 for all the things that they happen, that they live it, all the pain that they suffered, and for make sure that this is not going to happen again. And of course that the or working permission of the doctor has been analyzed again, because a professional like this don't have to work in this kind of hospitals, and especially they don't deserve to work in these surgeries as this complicate, just because this is not just a claim. This is not just a consult in your, in your consultory. I don't know how to say this.
Yeah, you can say in your office.
In your office. Well, and I think that's all.
Okay, thank you so much. I'm so happy that you like organize so easy from an any idea that we will do today, and that you choose your topic and you start to create an argument. I really like the part how you manage it, especially because that this, as you told us, this happen all the time, and you do it so natural. You start to speak so natural, without pressure, so relaxed. If I do some question, oh yeah, sure, this is the answer. We want this at least because this, and I guess that is so organized. Also, when you have some pressure on you, you didn't get rushed, and that is a really special key or skills that you need to develop. For example, for me, it's really difficult because when I get excited, I start to speak so fast, and sometimes the people don't understand me, especially in Spanish, of course. But you do it so good, so relaxed. So until here, you didn't owe me not. You didn't owe me nothing, right? We have all the speaking calls done, Vanessa. Sí, tenemos todas las llamadas. Quisiera saber si alguna llamada la hiciste a destiempo, porque estoy ya organizando mi informe final. ¿Tú recuerdas si ya había recuperado otra speaking call?
Tendría que revisar mi agenda y podría,
Ajá,
porque no recuerdo ahora.
súper. Te podría encargar esa tareita, a ver si de pronto, o sea, yo sé que en mi calendario general, yo sé que ya las hiciste todas, pero ahorita me están pidiendo que coloque en otro color las que estoy haciendo en recuperación, porque es
Ah,
un tiempo adicional. Entonces me toca. Sí, yo lo hago, así que necesito saber esa información porque no me acuerdo. Si la tienes, súper, y si no, no pasa nada.
ok. Voy a
¿Listo?
buscar, pero creo que todas las que tenía pendientes las hemos hecho hoy.
O sea, una. Tenías esa pendiente, porque
Tengo,
esta es la.
tengo una más,
Tenías,
dos tengo.
habías
La,
hecho,
la de
¿cuál?
Greenpeace y esta. Y la
Ok,
de, no sabía de qué tópico era del 5 de marzo.
ok,
Y
la del 5 ya la recuperamos.
la
Entonces,
del,
¿qué
ci-
haría faltando? Voy
la
a
del,
tomar nota.
la del 9 de marzo era, pero era sobre Greenpeace.
Ajá,
Esas dos me faltaban.
ok, entonces quedaría faltando la de Greenpeace,
Exacto.
que es la del 9 de marzo, ¿verdad?
Sí, la del 9 de marzo, 8 de marzo. 9 creo que era.
Vale, vale. Debe ser la del miércoles 10 de marzo.
Sí, porque me
No
dormí.
estuviste en la del miércoles, sí.
Y porque me tocó algo y me dormí. Esa teacher. Esa
Listo.
más.
Entonces, esa la estoy colocando como pendiente.
Ya.
Y pégale una maquinadita rápida, porque para mí creo que no. Hemos realizado una speaking call a destiempo, o sea, como en otro día. Pues,
No, no, todas las que tenía pendientes las hemos guardado, creo.
listo, súper. Porque
Pero
con
bueno,
algunas personas sí he hecho. Te encargaría que revises y que por favor me envíes un mensajito.
listo,
¿Sí?
teacher, gracias.
Ay, muchas gracias. Antes de que te vayas, por favor, te voy a encargar que llenes la encuesta.
Lo hice, teacher.
Gracias, que estés muy
Dale.
bien. Perfecto. Chao, chao. Francela, hello. Good night. How are you? Hello? Someone here?
Good talk.
Yes, I can listen. How are you?
Hi, how are you?
Everything is so good. Are you busy? I feel you like, are you driving or something?
I'm going back home, but I can take the speaking call right now. It's fine.
Okay, perfect. Okay, the same question. Antes vamos con los problemas administrativos. ¿Tú recuerdas si hemos hecho alguna speaking call en un horario diferente al programado? aparte de las que vamos a hacer hoy?
No, tengo solamente la de patentes, pero en todas las escuelas.
Ok. No, yo también tengo, o sea, yo tengo en las que no asististe y las que vamos a recuperar, pero antes habías perdido alguna y la habíamos recuperado en otro horario. ¿Recuerdas eso? ¿Nunca? Perfecto, súper. Entonces vamos a iniciar con con la de patentes. Para ese caso de las patentes, tú estuviste en la clase, ¿verdad? O sea,
Sí,
viste la clase. La idea era que nosotros, bueno, que tú escogieras una patente y la expusieras y dijeras, bueno, encontré esto en Google Patents and basically this is all the information that I want to share, and after that I will start to do some questions as always. So we will start first with patents and then we will go to medical negligence. Perfect.
okay. So
Can you do it there?
yes,
Like
the patent that I
comfortable?
found, yes, the patent that I found was from a bed. It's called like it's a bench that it's used to make exercises, but the name of the project is gym bed. Okay, so
Okay.
the inventor name is Lorne Durham. It's a person from the United States, and she filed it on January the 2nd, 2009. Basically, what
Mm-hmm.
that person proposed was a bed that can be closed. So you can close it, and it's a smaller than a regular bench that you're going to use when you're going to the gym. And basically, it has wheels, so you can spin it around, and you can close it as if you're closing like a kind of a book. Okay, so the design and everything, she thought that now that everything is changing, part of the things that can receive improvements, it's one of those gym beds, because this is something that you can carry if you're going, for example, if you're going on vacations inside of the same country. This is something that you can carry as part of your luggage, or you can take it to
Okay.
your office. And since the design and the size of it, it's a small, you can carry it on. Okay, she hired, let's see the name of, she hired an attorney. The name of that person was here. Center is Thorny Durham. Let me check if I can find the attorney.
No worries.
They already finished. They already read May 11, 2010, and this is something that has been in use since that date. Inventor notice. Oh, the attorney agent of the firm was Richard Mixel.
Okay.
So, yes, basically what she did was justifying the need of something that can be improved. And now that everything is changing, she said, we don't have like the time that we used to have in the past to design like an every day I would exercise, for example, at 5 a.m. in the morning. If you are professional, depending on the career that you are working, you should have like hours to exercise and to perform all of your hobbies. But since this is something that is not happening because of the changes in the world, the way she improved that was by creating the gym bed. So you can decide, you can take it on your car and you can decide at what time on the day you would be using it. And this is like a healthy way to, she also said that this is like a healthy way to recover also your mental health. Because when you're exercising, you're changing like, we call it here, usted cambia de cassette. So you're changing your mind, and it doesn't matter if you're stressed. Those are your 5 minutes or your 30 minutes during the day that then you can relax and take advantage of what you're doing.
Okay, perfect. And what about the use of the platform? Was easy for you? Do you think that it's easy to do it, or do you have some troubles about?
This is the first time that I use. So I didn't
Okay.
realize before that this was like a kind of resource that was available for us.
Mm-hmm.
So it was easy for me to find it, and it was showing me different kind of results. I read three of the same like kind of inventions, but the one that
Mm-hmm.
made me feel more confident was the one that I choose, because this is something that, for example, if it is sold in my country, this is something that I would definitely obtain, or something
Of
that I need.
course.
Para que es-
Perfect. No worries. If you have something to do before, I can wait for you a little bit
No, it's
because I
fine.
see that. Sure.
Yes,
But
it's
are
fine.
you not driving? Or yes? Are you driving? Or you are just in the car? I am losing the connection. If you
Not
want, you can.
driving. My boyfriend is the one who said today I'm just in the car. That's why I told him you should park. You're losing the car. We can find.
Okay. Can you please, if you want, you can turn off the camera and then we will have a better connection. That will helps, always helps. Okay. So, other important thing in this case, Francela, is how is this aspect working in your country? Do you have an idea how you can register a patent in Costa Rica?
Yes. Okay. We can do it here at we call it here Registro Nacional, National Registry. There you can file your invention, and they assign you a code, and they studied what you are. Well, they first of all they check that it is not like similar to something that anybody has already registered, and then they assign you a code, and then after that you are authorized to say I'm the owner of it. But again, as you were telling before, it's always important to hire an attorney who can represent you during the process, because if you're not specialized in the matter that you are requesting assistance, that person can take care of it, and that person can be responsible for all of the process, all of the stages, and can notify you if something needs to be changed or if everything is going good.
Okay, perfect. We will start to move into our next session. This one was, I am trying to figure out here in my schedules. So Francela, I guess that this is the only one that you owe me.
Hmm.
Let me
Yes,
see.
that was the only one.
Yes, 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 yes. Perfect. And now about the one of today, we have, I don't know if you can see my chat and all the information that I put in the chat, or do you want that I send it again?
Let's see. Here on Zoom, or
Yes, in Zoom.
no, I do not see
Okay,
what.
I will put it again. Now, you can see?
Uh-huh.
Yes, perfect. So I wanted to read all these aspects, please, and you select one and tell me when you select it.
The one that says perform a surgical intervention with harmful results for the patient.
Yes, perfect. Do you remember the improvisation exercise that we had in migration law?
Yes.
Perfect. Today we will do the same. You can imagine any context that you want with the people that you want, the circumstances that you want. You can do it for a trial, for a decision, for a sentence, for a jury, for a judge, whatever that you want to explain. Because what something happens on the knees, on the stomach, on the brain, whatever circumstance that you want to explain to me, and please remember, use some bases about the videos that you saw. Try to do a nice argument talking about all the rights of the victim, talking about all the affectation, and also focus in the conclusion of the aspect. How much money do you want to ask for indemnization, and who has to pay it? And that's it. Your time starts now.
Okay. The name of the guy who has been affected is Diego Ruiz. He had an accident, a car accident, in where he was about to lose both of his legs.
Yes, yes, I can listen.
All of the exams and labs were supposed to. They proposed a method in where they were installing. It's like a
Fran, I cannot listen to you, sorry.
like a
Hello.
Gali, ¿me
Hello. No, I cannot listen at all.
escucha?
No, 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 I cannot listen.
Ok, voy a salir y voy a volver a ingresar.
Now I am listen. I listen that. Continue talking.
Okay, so the name of the guy is, I would start again from the beginning. The name
Yes,
of the guy
perfect.
who had the name of the guy who had the accident is Diego Ruiz. He had a car accident in where he was about to lose both of his legs. So the national insurance company in Costa Rica was supposed to take all of the labs regarding all of the bacteria that he can have in his body, all of the clinical history. They should be taken labs of glucosa and enzymes and different kind of normal laboratories that are supposed to be taken prior to an hospitalization for the surgery. Okay, so the doctors decide that he should have in one of his legs, instead of cutting all of the leg, they would put a part of titanium on his leg. Okay, so they finished the process. This guy was now starting his normal life, and then after 6 years of being surgery, he suffered his bone again got broken. Okay, then the hospital took different labs and they realized that the part of the body that they were supposed to fix is not being fixed, and now it is being destroyed because he is allergic to the titanium that was placed on his leg. Basically, this guy, he used to be a guy with normal life. He used to go to work. He is a guy that used to do exercise, and now he is being handicapped. He has been handicapped after he had the accident, but now he suffers a leg that is broken. So he is not even able to drive his car. He is now not even able to walk normally because there is a part of his bone that is missing. The same, it's because he is allergic to the method that they use. The activities that the hospital performed were not following all of the protocols, and now he cannot walk. He is now somebody who needs always assistance when he is trying to perform his normal activities. And now we're going to sue the National Institute of Costa Rica because even if all of the tests were performed on time, the doctor missed one of the steps at the end of the surgery. Before he um, should coser, before he, how can I say, before he was supposed to close his leg?
Yeah, sounds perfect.
Okay.
Or
Before,
yes, like to do to sew maybe, like to sew up,
okay.
like this. I'll put it in the chat. To sew up, or maybe you can just to what other way you can say this? Maybe close the wound like this.
Before his leg was supposed to be closed, the doctor, even if all of the labs were perfect and normal,
Wound. Ahí no me está. Espera. Wound. Now, perfect. I'm not sure if you are seeing the chat.
all of the file, they realized that part of the procedure was not performed normally. And now this guy is going back. Diego is going back to the hospital. Now he already lose 10 centimeters of his femur, and now he it's already handicapped. Now this guy needs to go ahead again and needs to start all of the process. He is now infected with a bacteria that was caused because the body was fighting against the met that no, it's not like a metal against the titanium. And now the hospital realized that this is something that was their fault because at the beginning they should decide what is the best procedure for him, to cut his leg or to start working in a process that is changing his life, but he has his leg, but now he is infected. And now they need to decide what needs to be done. So basically, after all of those changes that come as a consequence of the breach of the protocol that the doctor performed at the end of the surgery, are causing him to go back to the hospital and are taking him back to that moment when he had the accident. He now is reminding how difficult was his life after the accident that he didn't cause, that when his car was crashed by another guy. And now he is going back to the pain that he is suffering when he cannot walk, when he is not even able to put on his clothes because his bone is again outside of his body. So he is not even a person that can go out of his house, not even using a wheelchair. He needs somebody who assists him when he is taking a shower. He is not allowed to do exercise. He is not allowed to walk by his own, not even being assisted by muletas. This is how we call it here. He had to change the structure of his house because he is now handicapped and he used to live in a second floor. Now he's not even able to go to the second floor unless he installs like an elevator inside of his house, that and this is not an option for him because he is a person not he's not a rich person. So
No,
what we
I
are
am going. I'm sorry. I am going like quite slow. So crutches is the way that we call muletas.
coaxials coaxials.
Crutches. Can you see the
Okay.
chat?
Mhm.
Yeah, crutches.
That's it. Okay, so what we are requesting, since he is suffering now of mental illness due to the pain that he has been exposed, and he is now dependent on medications to calm his pain, and those medications are prescribed because are we call it here, let's see here, uh, are special prescriptions that that has like a green receipt, because are um, a kind of harmful drugs that are used for pain, for calming the pain. And he is getting crazy because he is now dependent on those medications. And because all of the way his life changed, what we're requesting the jury is, and let's see, it's about $60,000, because all of his life being became in handicap and dependent on a third party who always assist him, because all of the money that he invested in physical therapy and didn't work because of the bone not accepting the material that was used without being tested before. All of his life changed. He used to be a guy who can go to work and who can do everything by his own, and now he is dependent on somebody else who can assist him, who can take him to, if he needs to go to the supermarket, he needs somebody who go with him. And because of the medications that he is now dependent, he is not even able to make his decisions. So basically this is what we are requesting. It can sound a lot, but it is not allowed if you have 42 years old and you are now not able to continue working as a profession that you graduated from the school. Listo.
Um, Fran, and how much money do you want by the compensation? Can you please repeat?
Yes, $60,000. That's
For what concepts?
for what concepts? Okay, we're asking $60,000 because he was he is now retired as handicap, and his productive years to retire in the country, he should work during more than 20 years, and his income is now reduced to like a monthly payment or pension for handicap of $500. And his monthly income used to be $3,000. We know that we cannot beg for $3,000 per month until the age that he should retire. But since he is having medical illness right now and his family depends on him, and he was the main guy who bring them food and everything, who paid all of the bills for his children, and they need to go to college and they cannot afford it with the money that he is taking right now. He needs to buy a wheelchair. His wheelchair requires a special standards. Since he cannot move a part of his body, the wheelchair needs to be electric. So he needs to have enough money to continue in movement, and he needs to pay someone who take care of him. The way that we're doing it is, and he needs to buy a new car in where he can get in with his new wheelchair. That's why we're requesting 60,000, because we already quote the car that he needs, and the car that he requires, it's $25,000. And we think that that's the amount of money that can be, it's never going to be fair because his life changed after this, but it's something that can be, um is not fair because it will never be fair. So it's something that can help him to continue his normal life in now being handicapped. So it can be accepted, those $60,000.
Okay, thank you so much. I really like it. I really like it. You do it perfect. First, you take all the time. Second, you give an structure, a whole story. You use creativity. You use all the arguments. Something that is so specific, like gaunt or stew up. That is something like that we didn't have to use all time, and it's normal that we didn't get that kind of vocabulary. But after that, it's completely normal, and you do it perfect. Your score is like 10/10. I love it. And I hope, it's so sad that we cannot use the camera tonight, but I want that you try to compare the first one that I remember that was really good with this one that is the last one that we will have in this course. I can see your improvement. I like the way that you explain it, and especially the way so natural that you answer the question about what concepts. Oh, yes, sure. The concepts are this. I really like that kinds of answers. I really enjoyed it. And yeah, that's it. So we are done with our speaking calls until today. Um, we have everything clear, no doubts, and you don't owe me nothing. And I will please ask you that you fill the survey before you go. And that's it. I will see you the next week. Enjoy your weekend.
Thank you.
Thanks to you.
Goodbye.
Okay, bye bye. Silvana, how are you? Hello.
Hi.
We have to close this video with Francela because she had a bad signal tonight. But now we are going to the video again. We have a really interesting activity. I know that you remember the first case with migration. That was like a
I
case for
remember.
improvisation. Okay. So we will see what will all the things that we learn in this process, how we will manage the tension, the stress, and etc. All the circumstances that I want that you explain and that you want to defend in this fake trial would be on you, up to you. The people that is going around, the situations, the doctor, the nurses, the clinic, the hospital, the compensation, everything will be from your mind, and you are completely free. If you want to do it from a trial or just for an administrative process, or if you want to do it for a judge or for a jury, is on you. But you need to choose one of these topics. I will copy and paste it in this chat. So try to be wise to choose the topic that you want to explain. And after that, your time starts. Your time starts.
Wait, I'm reading.
No worries.
um, lack of post-operative supervision can be like a pregnancy case, like they didn't have this have that malpractice here, and then the consequences when, I don't know, the baby has 1 year or something like that.
Whatever that you want to do.
Okay.
You are completely
Okay.
free. Okay, so you just take a breath and tell me when I can start.
Yeah.
No
Okay.
worries, you will do it so good. Okay? So
Okay.
we'll start right now. Your time starts now.
Okay. Yuri, we have now here a case about a malpractice in a childbirth that is about a little kid that had a malfunction or a fetal distress during the birth, and 1 year later, um, and 1 year later he was diagnosed with quadriplegic. So first, we have the clinic Maison de Santé that is the responsible of this malpractice, because 1 hour before the birth, the mom was telling that she wasn't feeling good, that she wasn't feeling some that the baby wasn't in the best position to give birth, and the nurses just ignore her, ignore the parents, ignore the husband, ignore everyone that wants to help her to give birth properly. And uh, reviewing or checking the standard of the case, of the care, I'm sorry, of the care. As you can see, when you have a fetal distress, you have to cut some part of the vagina to help the baby birth. But in this case, the doctors, and it was proven because the parents of Lilia and the husband were in the room of birth. So they also told us that the baby was pushed, and then the I don't know, the cervical part was had a damage. We can prove also this because 1 year after the baby was born, we have what's the name? We have a diagnosis of an orthopedist and also a neurologist that says that he had this problem, and the caution was since the birth, since he was at birth. He was since he was born. I'm sorry. That's why, as we can see, we have all the process. We check the standards, we check the breach. We have here the accusation is clear. The doctors had a malpractice in the birth and demand as a compensation because this kid would never gonna walk. So they have some expectations. Is their first kid, and he will never walk again, even if he have this rehabilitation or of non atrophied muscles. He will never walk again. That's why, as a compensation, we ask for $5 million first for the damage, and then $10 million because of the rehabilitations. Then the insurance is not going to cover this kind of damages that you have caused, that the clinic have caused. So in that way, we're gonna explain all the expectations that the parents have for this kid. This family will never see this kid play, because play some sports like football. The family have every time their family members always have this tradition to play football. They will never do it. Also, they have these expectations for him to be someone able to develop himself great. And they had all this process of in vitro fertilization to have this baby. So after all these years trying to have a baby, they have a malpractice that have caused a huge damage, the suffering, the pain. How are you going to evaluate all that? We have to see how much pain they have right now, because her kid is not going to move. He's gonna, and also psychologically, they're gonna suffer all the time. They need some therapies. They need a psychology there for them, and we need to evaluate all that matters to calculate a compensation. Maybe you're gonna think that the compensation that I'm asking for is too high, but it's up to you to have to make this money, make this their lives easier, because they're not gonna have some improvement from his child. So what else? What else? Okay, continue. What else?
No worries, no worries. I know that it's so hard to continue with the story, but I will give you some ideas. You are doing perfect. You can talk about all the, I don't know, the contracts that the family signs before the surgery that explain that you will have a specialized doctor or a specialized equipment or team that will help that you don't have any accidents. You can talk about insurance. You can talk about um, all these.
Bless you.
No, lo perdí. También puedes hablar acerca de all these post-operation and like all the consequences about. But also you can go in because you have 5 minutes. You can go about the need. You can talk about the need and the um, matter that from law we can control these kind of circumstances and then give them a lesson and don't happen again. But also you can talk about proofs. I really like the part when you are like, yes, we have this and we will prove it with this, and I like it. So continue doing like that. Then you can take like a sentimental way, like judge. You need to understand these, and you can talk about the consequences. Then by the end, you can talk about how much money do you want. I'm talking about psychological, psychiatric, um, psychological, the psyches, like all the damages that you're having like so deeply, not by psycho. And you can talk about all the consequences in the materials or the needs that they will start to need every time that they are growing, and also the like the emotional process across this sickness or these bad consequences, and how basically your life can change in a minute. In this kind, when always when we talk about an accident in a newborn, we can start to talk about some hypothetical cases. Like, what about if he wants to be a doctor? He cannot because this change in the part of the brain that can, I don't know, manage all the information that you put in, and this will affect that. But what about if he wants to become a football player? He can't because the part of the brain that's try to control all these legs or
Function.
the body, one kind of coordination cannot work in the same way because of the law. So this always works, and especially when you are working with the jury. Other thing that can be so specific is you are talking with a multiple person or people where everybody can have a different context, and you need to use that context. So if you are talking about this case for a moment, etc., you can suggest them. Like, I want that you imagine that you have this situation with your kid. How much money do you want for that indemnization? But what about if it's your, I don't know, son? What about if you tell to the doctor that be careful because you're not feeling good if you are not listening? How do you want that you get a compensation for changing the life of your son, for your child that you have been waiting for years? So put yourself in this situation. Imagine I am here representing this case, but we can talk about all of us because we have kids. I can take your case also. This is real and this is happening all days, and they are not taking care of blah, blah, blah. And then you start to build your argument in this way.
Okay.
Okay, you have 2 minutes.
Okay. So I'm gonna start with that part, the last part. Okay. Imagine that your kid has his damage. Imagine that if he wants to be a pilot, imagine if he wants to be a Formula One pilot, and he will never do it. He will need always a wheelchair, something extra to move, even in the case he could do it with all the rehabilitation that they're gonna have. Imagine how their self-esteem is gonna be to see other kids having fun, doing whatever they want because they will, but he wouldn't do it alone. Imagine that your kid is having, I don't know, is having some other problems that starts with their brains, it start with their legs, it start with some other other parts of their bodies, and then he died. How bad you will feel, how this compensation could be if you were the parent. It's malpractice in childbirth is the third reason of babies to for that cases that when baby dies in their childbirth is the third reason. We have a lot in this country. That's why we need to demonstrate. You need to demonstrate this society is not going to accept that kind of damages because they're going to be forever. Even if that forever that only takes 20 years or 15 years. We have the proofs here that before this childbirth, they had a great equipment like 12 nurses because it was 1 year. It was only 1 hour uh, after the contract the cramps started, and that's why the mom wasn't feeling good. She needed a lot of people that it's supposed to be capacitated, have the skills to do this kind of procedures. But in this time the malpractice was so, but has an awful result because 1 year later we have a new evidence a new evidence that this malpractice that this malpractice happens. As a compensation, we want $5 million for the damage in the childbirth, and then we want $10 million for all the process because the process is gonna be the son's life like forever. Thank you. Okay. Your microphone.
I had yes. Okay, you do it so good. I don't know why you feel quite nervous. You do it so good, and it's just process. When you have time to try to imagine one exercise of improvisation when you are brushing your teeth or before to sleep, start to imagine hypothetical situations and try to put yourself on it. Maybe I can to debate this or talk about this and this and this, and this is a way to put a little bit of creativity in your brain. And when the time arrives, you will be ready for use all the skills that you are having development. Imagine that you are running, that you run 1 square every week. By a month, you can start to get adaptation to this process. And when you need to run 5 or 7, you can do it because your brain is slowly getting prepared for that state. Okay, so now after that I really like it. I love it. I love how you manage the topic and how you manage this case, but also how you start to use all the information that you saw before. So thank you so much for your time.
Thank
Before
you.
you leave, I will ask you that you fill the survey.
Oh, I already feel it. Mhm.
Okay, perfect. And you didn't owe me any session, right?
No.
Nothing. Perfect. So I will see you the next week. Thank you so much for
Okay.
your time
Thank you, Gali.
and have a nice weekend.
Thank you. Bye. See
Okay,
you.
thanks to you. Bye bye. Maria, hello, how are you?
Sorry, I thought that I was programmed at 7. I didn't.
No worries.
Yeah.
No worries. I just saw this and we are having 7. Perfect. You owe me one session of a speaking call. I want to check.
Uh, two, two of
Yes.
them, the Brexit and the other one that I did this week.
Okay. I have like more.
More.
Yes, I will tell you the topics. Maybe something wrong here. but I have here Friday 5 of March. I
What was the
have,
topic?
I know I didn't have it for topics. I have like the dates, but I can search the topics for you. I have, yes, March 5, 10, 11, and
That's 2 months. No, I just
and
remember the
Wednesday.
Brexit and the
María
other
Erlinda.
one.
Sí, María Erlinda. Qué raro. Voy a buscar en mis notas y a ubicar cuál es el del Brexit y qué otra tienes.
It was this week.
Y Brexit, ay, tengo. Voy a anotarlo en tu chat. Así vamos arreglando temitas. Porque sí, eso tengo, me parece muy raro.
No, sí, he dado los bueno, de que yo me acuerdo, solo me acuerdo del Brexit y de esta semana.
Tranquila. Voy a anotarlo acá, en nuestro chat. Brexit y esta semana hablamos de international law. Perfecto. Entonces, yo voy a este fin de semana voy a estudiar bien las notas y las voy a comparar. De pronto es un error mío o te confundí con alguien más, que puede ser, soy humana. Y te aviso para que busquemos la manera de acomodarlas. Yo hoy estoy adelantando unas que me deben. Si se llega a abrir un tiempo, yo te voy a avisar para que lo puedas preparar. No va a ser como tan de repente. Voy a organizar esto este fin de semana. Y bueno, vamos a comenzar con la actividad de hoy. So do you remember the exercise that we had before with migration law that was a process of improvisation? I want that today you do the same. You can imagine whatever circumstances that you want to explain us. You can talk about a judge in front of the judge of the jury. You can talk about every familiar topic. You can discuss about the compensation, the situation, the consequences, how the facts happened. But you need to take into account one of these topics. So you will choose one, and from that, you will start to create all the argument. It's so important that you talk about the concept of indemnization. How much money do you want and why? And also the facts and the conclusion. Okay? And yeah, when you want to start, tell me the one that you will choose, not following certain protocols. Perfect. So your time starts right now. Take a breath. And we will start, okay? Now.
Okay. Thank you so much, Your Honor, for this moment. I'm going to start talking about Anna. Anna was an 11-year-old girl. She had been practicing volleyball during her life. She was selected by the national Peruvian team of volleyball, and every person who knew Anna said that her smile was so sweet that it could have the power to fix anyone's bad day. She was very loved by her parents, a really, really good student. And the 11th of September, she went to the Mariscal's hospital because she had a cold, just a cold. Sadly, she left this hospital dead. What happened with her? What the doctors did to her? If you see the security cameras, you will find her father crying at the driveway because of her death, and you'll also see that this family's worst nightmares had become true. To show this court that what we are alleging right now, it's true, we want to define some points. First of all, I want to talk about the standard of care. We do believe doctors are humans. They can have some mistakes, but we don't expect they are perfect. Before me, there was an expert who testified about this standard of care that they have been following, and they didn't follow the correct protocol. The correct protocol is ask the patient if they have any allergy, or if they are taking some pills or some medicine that are not normally used or something like that. But they didn't ask Anna. Anna has been taking some medicine, and because she has an illness, They didn't ask her. And she went to this hospital with her mom. Her mom also doesn't know nothing about medicine. She is an engineer. She didn't know nothing about the protocols. And as it was a simple cold, her mother was not was very was not very uh, bad with the idea of taking her to the hospital, but they didn't ask nothing. The doctor breach of the standard of care, we also are going to talk about this. Um, did the doctors did something reasonable, or did the doctors did something that a reasonable doctor would do in this kind of circumstances? As we said, no, because they didn't follow their own protocols that are regulated in our rights and law here in Peru, but we all that also are a part of the protocols of the same hospital. Finally, we can conclude that the negligence of the doctor created the harm and the death of this little girl. So, in this moment, Your Honor, I'm here to beg justice for this family. Money is not going to take to raise this girl from death. This reparation will be used to pay, first of all, for the psychological treatment of the family. And secondly, the family wants to move from that house because that house is right in front of this hospital, and has it is not a really good memory for them. So we are asking for $10 million for the reparation for this family, and we are also requiring the suspension of the doctor's license, so this could never happen again to another family. Thank you.
Okay, perfect. I love that you have like all my recommendations on your speech, but also that you finish before like 4 minutes, more or less, and with all the natural you say like, okay, thank you so much for your time. And that is also an important skills, because sometimes we try to find more arguments and try to going around and around for a whole point. And sometimes it's just say, okay, thank you so much. I don't have nothing more to say. This, and etc. One thing that I can suggest to you for the first time is for the next time, sorry, is how maybe you can announce some proofs, or you can like get related some proofs in your speech. Like for example, the damages that will be proved with the document signed by the healthcare organization in the country. But also, we will talk about the testify, or I don't know, from the first person that checked the patient. So that is important, just as a note that I can see from your speech. But after that, I really like it. It's like clear, you didn't get anxious or nervous. You do it like so normal, and that is really important.
Thank you.
Before you sorry that here I
The
don't
survey.
know what's not working my headphones. Can you listen?
Yes.
You listen all the things that I say?
Yep.
What's your name? Yes, okay, perfect. So important that you please fill the survey before you leave. And I will oversee all these schedules, and I will try to find where is the wrong stuff, and I will tell you good time, and then you can reorganize your things, and we can see each other soon for recover that sessions.
Okay.
Okay, so thank you so much for your time, and I will see you soon.
Thank you, Gali. Bye bye.
Have a nice weekend. You fill the survey right now, okay?
Yes. Yes, I
You do
did.
it.
Yep.
Okay.
Thank
Thank you
you.
so much. Okay, bye bye. Okay. Hello, Gabriela. Good night. How are you? Can you listen?
Hi, Lali. How
How
are
is
you?
everything going? I'm fine. What about you?
Happy because today is Friday.
It's Friday. I'm so happy for listening that. Before I start the lesson, I want to check that you didn't owe me one speaking call, or if you owe me, I need to get like a result. I know that you have one.
Yes, about environmental problem.
Yeah, just about the environmental issue.
Yes,
Okay. Do you remember when was that? Like on a March night of March, right?
it's
Yeah.
5 of March.
Let me see. March 5. Yes, Gabriela. Yes. Okay. I will. I will. I
Sorry,
7777.
it's freeze
Oh,
the,
yeah.
the screen.
I will. I will give you one of these days the day
God, sorry,
start
didn't
to
understand because it's freezy.
do some today, but I am here again. Hello.
It's
I am free.
freezy. Yes. I don't know
Hello,
what
hello,
happened
hello.
with the
I am
connection.
free. Can you listen? Oh my
Now,
God.
yes.
Hate.
What happened?
Gabriela. Hello, hello.
Hi.
Here. So I want to please ask you now. Can you listen? Can you please confirm?
Yes, now, yes.
Okay, perfect. So I will reschedule other session for you in one of these days, and I will please ask you if you have time to show the videos for this activity of medical
but
proceedings
I,
or
I don't I
medical
don't I don't
negligence.
listen. I don't listen what days we do that the last speaking call.
No worries. I will I will tell you. I will tell you when. So we
Okay.
will find time to do it. No worries at all. Okay?
Okay. Yeah.
But for tonight, do you have time to see the videos of medical proceedings?
Yes.
Yes.
But
Okay.
the most
So I
long
want that you
video.
see your chat.
Your chat. Okay.
Yeah, I just want that you see one part of it. Oh, it's not working. Give me a second. Okay, so here, please. I want that you choose one of these topics. We are having really bad connection today. I don't know why.
I don't know. For I listen como que.
Okay, I want that you check one, for example, delay or error in the diagnosis for a patient, not following certain protocols, or filling an inappropriate prescription of medications, perform a surgical intervention with harmful results for the patient, contamination of a serious infection due to a lack of a hygiene in the hospital center, forgetting surgical material inside of the patient, failure to provide emergency healthcare, lack of post-operative supervision. Choose one.
Mm, maybe maybe failure to provide emergency healthcare.
Perfect. So, do you remember the exercise that we had about improvisation in our migration lesson?
Yes. Yes.
Okay, we will go back again. I need to check it that you change, that you are using all the skills that we have been learning in this course. So it's important that you create a case, like with all your
Gali,
activities that
sorry,
you find,
I
any
didn't
circumstances
understand
that you
again.
want.
I didn't understand the connection is.
What can I do? I guess that is because a lot of people connected in the internet. Now, are you listen?
Yes, now yes.
Okay, I will try to move it on the bed, and then wait. We'll manage this. No worries, no worries. Maybe it will be better. Oh, the connection because I am here.
Yes,
I am close to the Wi-Fi
to the
router.
mother.
Now,
To the mother.
yeah.
Yes,
Now, can you listen
yes.
better?
Yeah.
Okay, okay. The plan is that you choose one of these topics and that you create a case in your head, like any circumstances that you want, the case, the people around, the judges, or in front of the jury. Everything that you want to create in your mind is available to use it. But also, you need to create this context around the topic that you just choose. If you want to change it, you can do it.
Maybe in a trial, really.
Yes, in a trial, you need to represent the victim and you need to explain to the judge all the proof that you have to show the damages. It's important that in the argument you give me some structure. This is the case that happened, this is against the law because this of this or this, and this is the conclusion. I want this amount of money for indemnification in this case, and the proof that I got is this. You can imagine whatever that you want, put the information in a stomach, in the brain, in the knee, in the leg, whatever, maybe in a burn, in a surgery, in a dentist proceeding, whatever that you want to tell me. And your time starts now.
How many times have 5 minutes? 3 minutes?
You have 6 minutes.
Yeah. 6 minutes to
It's not,
invent and then say it?
no, 6 minutes for a start right now.
Oh my God. Okay.
No worries. Just take a breath and start.
Okay, yeah. Um, yeah. Maria is a 40 years old lady who had a sore throat. Uh, uh, she has a sore throat, but she cannot important too much to the beginning. But her husband insists to they go to emergency. I don't know why, because it's so common. Maybe if you have sore throat or something like that, I take a pill. So, by this time, she decided to go to the hospital. So when she stay in the hospital in a emergency in the emergency, the doctor examines her, and this is maybe only a simple sore throat, but he he give her to the prescription with some pills and over. Um, 1 week after, but with the next week, um, she continues with the sore throat. So he go back to the emergency, and another doctor say, another doctor says, I'm not sure about this pronunciation, but thyroid problem. He's
Sorry, I cannot understand that word. What?
thyroid. Es como que tiroides.
Ah, ok. Thyroid.
Thyroid.
Es re difícil de pronunciar.
So I remember the name, but I don't remember the
thyroid.
Thyroid.
No. We will solve this with Google Translate. We need to get ready about sure about this pronunciation. Give me a second. We will learn together. Sé cómo se dice tiroidismo, tiroides, pero tiroides no. Thyroid. Wait. Thyroid. Perfect. Thyroid.
Yeah.
Y tiroidismo, que es un poco más difícil. Tiroidismo. Ay, espera. Como había desconectado el internet, no me carga. Espera. Tiroidismo is thyroid.
Thyroidism. Yeah, it's so difficult.
Thyroidism. Okay, continue.
Yeah, continue. Thyroid. Yeah, he has a thyroid problem. It's so confused for her because to start she start with a sore throat and then a thyroid problem. So it's so in one moment her maybe the doctor said if a few days ago maybe she goes to the hospital, maybe she didn't need a surgery. So the problem start with that. The doctors the negligence start with two sorry
negligence.
The negligence start with two problems when the doctor doesn't have a standard care at the breach the standard of care. So the combination of that is the negligence. So maybe the lawyer present all the medical exams to when the first doctor say he only has a sore throat problem, and then when another doctor say more medical exams, and they said he has a surgery of the thyroid. And that I don't know what one more.
How much money do you are asking to this judge?
Yes, yeah. Maybe well, if the problem is not so big, no, someone passed to die, only the money of she needs of the surgery recuperation of that.
Okay, perfect. That is how much money?
$10,000.
Okay, no, nothing. Okay, perfect. I feel you a little bit nervous, but that is normal because as you see, it is like a lot of medical terms that we didn't manage and it's so new for us. So no worries, you do it so good. Thank you so much for your time. And before you leave, I will ask you that you fill the survey. Perfect. I will to send you when we can like recovery or lesson, and I will tell you also the topic that we manage that session. And do you remember the topic?
Yes, we need to tell the story about your environment problem to feel the inspiration for the report.
Okay, perfect. Do you want to do it now? Because if you want, I have 15 minutes for do it, and when we do
yes.
it. If you feel ready, we can do it now.
Yeah, because I did my report.
Yeah, we will talk about. perfect.
Yeah,
Tell me,
because
what environmental problem did you choose? And after that, I will start to do some questions.
it's so about but it's all about a mercury problem.
Yeah.
A mercury problem is a leak. Derrames leak, really? Yes, leak of
Yeah, yeah, yeah.
mercury. Yeah,
Yeah, yeah,
leak.
yeah.
Yeah, there
Of just a contamination of
for
mercury.
a
Will be
contamination
better.
of
Leak
mercury.
is more useful in a sexual way, like
Ah,
lamer, como lámeme, lame, chupa, se utiliza mucho. Así que ten cuidado con los usos de leak.
a leak, or maybe another word is a stroke, but
Stroke will be better, stroke, but
a
also
stroke.
it's just a contamination of mercury or a mercury
Yeah.
contamination.
Contamination of mercury, it's a product of a mining operation, because I mentioned it for the last speaking call. Mining is so important here to Peru. So
Okay.
it's so simple that the case is when the driver of the company, he transporting a lot of mercury to with a little I don't remember, with a little town to capital
City.
town
Yeah.
city, or to Lima. The name I don't
Okay.
remember too much, but it's a little town. I think in Cajamarca, something like that.
Okay.
When the driver take care about the about maybe he reported 4 liters of mercury in the middle of the street, and then many people go to the hospital in that place, who has a blood contamination about mercury. So because he cleaned the street, but is not enough to eliminate all the mercury. But when many people go to the hospital for that problem, they construction again all the street for eliminate all the mercury for that. And that is on the problem. It's little. So.
What about the consequences of mercury in the environment or on the environment?
Mm, I don't know. I don't remember. Maybe I don't know how to say in English. Maybe the inhalation of these uh, inhalation of the mercury maybe has a lot of consequence. Maybe ne, neuro, I found
¿Qué cosa?
neuro problemas neurológicos, because this is
Okay. Neurological consequences.
neurological
Neurological consequences.
neurological neurological consequence, because
Neurological, como de lógica. Logical, something is logical. Neuro, acuérdate primero. Neurological consequences.
neurological consequence, because the mercury affects direct to the system, nervous system. So
Perfect.
this is the I don't remember how the different can affect too much direct to kidney or kidney, riñones, kidney, I think.
Yeah.
Always have this problem to that.
This pronunciation is like also so hard to
Yeah, I
use.
don't. Medicals is so difficult.
Yeah, It's like you can say kidney.
Kidney,
Yeah.
yeah, because all the metals affect direct in the majority of case to kidney. Has a lot of
Okay. And what about the relationship between law and this environmental protection? What do you think that is the most important thing that we need to understand in this case?
Maybe a negligence. Maybe a negligence because when the health is affected, it is also so difficult
Yeah.
to
Do you
because
think that this kind of consequences we can solve it with money?
not because in sometimes uh, sometimes people diet sometimes people diet
Die. People die because diet is dieta.
in the,
Sometimes the people die.
sometimes people die and nobody come back to a life with all the money of the world. So maybe or maybe have a consequence that affect direct their health. Que consequence that doesn't permit to come back at to the normal life, that how to say. So maybe money helps to survive but not for have a normal life.
Okay. And what is your relationship with environmental law? How do you manage it in your personal life? Like, are interested in this area or not too much?
Yes, because I have some courses in the university about uh, environmental
Law?
law. Uh, well, it's so difficult here because not only environmental law, environmental in general. People maybe doesn't have the correct care about the world. For example, now everyone lives in middle of the pandemic. And the environment affects directs with that. For example, the max people take care in the middle of the street and something like that. I think the last year I studied what happened to the sea. Maybe
Because you have a lot of oceans. And in this
yeah.
case of Mercury, this Mercury arrives to the ocean?
No, it's only in the middle of the street. It's not longer too much because the principal company, uh, construction again all the street because to eliminate the mercury in the totality, because in the first time they only clean, but it's not enough to eliminate all.
Yeah, because this product is so toxic.
Yes, it's so heavy, I think.
It's heavy metal.
Yes. In only the gender or musical gender.
Okay, perfect. So with this exercise, we are done with our speaking calls. So you didn't owe me nothing. I want to check it again. I just want to be sure because I am doing my reports
Yes, because
right now, and this
the
is taking a lot of
the
time.
last week we no you check again and you say only
Okay.
one.
Okay, and do you stay in the lesson of yesterday, like of medical negligence?
No,
No.
I watch in the morning the class because I have classes yesterday.
Okay. Yes, perfect. So no worries. Thank you so much for your time. Enjoy your weekend,
Thank
and I
you.
will see you the next week.
Um
We're almost done with this. We are almost done, and
yes,
we have time to rest.
Yeah. This is the last speaking call or one more?
We will have one more, but I am waiting for the direction because they will start to with other courts specialized in law also, and we need to reorganize some dates for this speaking call. But I will keep you updated, and then we will plan it. So no worries. I will inform you with
Okay.
time, and then you can make time for this. Okay.
Okay.
So thank you so much for your
Thank
time.
you,
See you
Gali.
soon.
See you. Bye.
Okay. Bye bye. Hello, Rafael. Good night. How are you?
Good night, teacher. I'm fine.
Hi, nice that you are fine. How is everything going? Finally, Friday.
Yeah, I suppose.
Yeah, okay. I want to know if you have time to see the 3 videos that I
I
sent it
just
to
have
you.
time to show the two short videos and part of the long video, but I really don't understand it because I was in the street
In
and
the
it
work.
was
Okay. No worries. Okay,
cut
so
off.
do you remember when we start our lessons that we do one exercise of improvisation with migration law?
Yes, I remember.
Okay, so I want that you see one of these topics. You select one, your favorite, that is here, and tell me which one did you choose?
Uh,
You have delay or error in the diagnosis of a patient, not following certain protocols, offering an inappropriate prescription of medication, perform a surgical intervention with harmful results for the patient, contamination of a serious infection due to a lack of hygiene in the hospital center, forgetting surgical material inside of a patient, failure to provide emergency health care, lack of post-operative supervision.
okay, I'm going to choose the first, delay of or error in the diagnosis of a patient.
Perfect. So the instruction for this activity is that you will imagine that you are in front of a jury or in front of a judge, and you will explain a case. The circumstances, the parts, the process, the results, all the case, you need to create it by the road, and then you need to show like the consequences. What proofs do you want to show to the judge in this case? How much money do you want for all the damages? And if you have any questions, just ask that. If I can resolve it or solve it, I will help you so happily. So yeah, we are done. Tell me when you want to start. I give you the advice to put your mobile or your device in what point that you can support it by itself, and then you can have your hands free. That will help to produce ideas, but also to produce the speech. Okay?
Yeah, I don't have a place to put my cell phone, so.
Okay. Okay, do it like that. So
Um,
your time starts when you want. Okay.
okay.
1, 2, 3.
Okay. Mr. Judge of Tribunal. At first, I need to say that as all in this room know, my client died 2 days ago, and it was because these doctors uh, don't diagnose him at time. Like an introduction, we can start explaining which problems had my had my had the husband of my client, the husband which was dying, who was died, who died.
Mm-hmm.
In 2018, in the year of 2018, my client started to feel some damages on all their him body, and especially in their I don't remember the kidney riñones
Yeah, riñón, kidney.
kidney So when he came to the doctor, they do the analysis and they said that it was at first they said that it was probably a problem really a problem that could be diabetes. Diabetes. But then the men, ¿cómo puedo decir el difunto? O sea, de una manera formal, no creo que pueda estar diciendo ahí el hombre muerto, ¿verdad?
Yeah, you can say
The victim, puedo usar en este caso,
because
claro.
you can refer, the victim. You can say the victim, or you can say the passive subject of this claim. Estás como diciendo también como quien recibe las consecuencias lesivas, que es otra manera de decir la víctima. Pero una manera muy coloquial de decirla es like the dead person.
Okay. So the fatal victim did some other analysis in other clinics, and these other people said that it is truly not diabetes.
Can you sorry that I interrupt you. Can you see your chat?
Okay, let me see. The disease. Yeah.
Disease.
Yeah, this is the
Mm-hmm.
Yeah. So the other doctor said that actually they had a low in the blood.
Yeah.
Then the disease come back to the first doctors and they do other analysis. Said that it was cancer. It was probably cancer. Other analysis demonstrate that
shows también puedes decir shows
that it was not the case.
Mm-hmm.
And when my client, after 2 years of visit this clinic, actually died. Then they said that it was a renal problem that they don't discover at that time. But actually they have a lot of time to see or at least suspected about this. Then they live a family with 2 kids and his wife alone, and they of course need some money reparation,
indemnization,
yeah.
compensation,
that was.
or you can say like other thing.
So I think
compensation, reparation.
They need a reparation.
Okay, how much money are you asking for in this case?
I don't know how much money. I really don't know.
Just give a number. No, just give a number. You never say to answer so secure about the money that you're asking. Yeah. It's the same that when you have a client and you need to make that deal. En español decimos un dicho muy común en mi país, es como depende del marrano. So here if you say that he has money, no, but you put your standard of your service, because it's a quality service, you put it high. And if you don't pay it, you didn't waste
Yeah,
your
but I
time.
don't know how much
But
is a lot
always
of
so secure that no, I don't know. No worries,
shouldn't
just give a number. This is a fake, so no
10,000
worries.
dollars. So we demand
Okay, for what
10,000
concepts? Why?
for the injuries and damages caused to the family in order that the deceased person, the family lost this man that which who was important part of the economy stability of the
The
family.
family. Mhm.
Yeah.
Okay, perfect. And what happened if this judge didn't accept this indemnization, or your petition or your request? What do you will do as a lawyer of this person that died?
Yeah, I think I need to appeal to superior authorities.
Tribunal authority, yes, perfect. And what proofs you will show to this jury for your claim? What are your proofs?
Yeah, I'm going to present an investigation uh, did for other experts in medicine
Mhm.
in order to demonstrate that in the average
Physicians, médicos. Doctors, you can say doctors or physicians.
yeah, it's the first time that I physicians. Okay,
Yeah, physicians.
so I'm going to present the analysis of other physicians that demonstrate that actually in the average of the cases like this physicians could find some evidence of the sickness that this is the father of the family that I represent. In other cases, these 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 physicians, these physicians, in
Yes,
other cases,
physicians.
physicians suspected, at least suspected about this and do the proofs to know if it was something bad with their kidney.
Okay, perfect. I really liked your intervention. It was so structured. It was like relaxed. So thank you so much for your time. Rafael, before you go, I need to check. You owe me one speaking call. ¿Recuerdas si me debes algunas
Two
speaking calls?
speaking actually.
Two. I have
Yeah.
here. I will tell you the topics. I have February 26 and March 3. Okay. So I will check the topics and I will let you know when we will um, get these sessions. Okay.
Okay.
Because we are so close to finish the course. And before you leave, I will ask you please that you fill the survey. And yeah, we are done for tonight. Rest, enjoy your weekend, and I will see you the next week.
See you.
Thank you so much. Okay, see you. Hello, Laura. Good night. How are you?
Hey, how are you?
Yes, I am fine. What about you? How is everything going?
Yeah, it's okay.
Okay, nice. Okay, Laura, before I start with our session, I need to check. You just, oh, we will do like medical negligence and the speaking call of patents, right?
Yeah.
After that, you owe me something more?
No. The only speaking call that I missed was the one with the patents.
Okay, that was on February 24, right?
Yeah.
Okay, I will put it. We will start with patents, and then we
Yeah?
will go. Yes,
Okay.
and then we will talk about medical proceedings. So
Okay.
first, this one. Tell me, which patent did you choose? Why? What did you choose, and how did you find it? And what was your experience using Google Patents?
Okay, so the first thing I thought was a little bit more modern. I was thinking about a monitor for babies, like a robot that could take care of your baby. Like its only devotion would be the baby. But that was like, I couldn't find anything. They have like best case scenario interaction robots that can like maybe be a company for human beings, but that would be it. So I was thinking, what was another thing that I have been pretty upset about and worried about, like since I can remember, and this leads to let me check the complete name of this patent that I found. It's a self-protection shoe to safeguard women against dangers.
Okay, nice.
I
Really
tried
interesting
to,
topic.
yeah, I tried to look for different artifacts that could help women defend on men and anything, children too, anyone who can have like an attack or suffer a kidnap or something like that. But obviously it was very delicate because you can't, there's a limit with the human rights of the other person, even if it's attacking you or if it wants to rape you or whatever. So this
Yeah.
shoe, it's like something that can help you prevent these attacks. It works like with a chip on it, a small chip, a button that you have below your thumbs that you can press whenever you are in danger. So this alerts the nearest police station, the nearest five mobile cell phones that are near you, so that they can get like a message or something like that that says there's a woman in danger and this is the location. It works like with GPS, and it can also send a message to the person that you
Okay.
choose. It could be like your husband or your parents, your brother, I don't know, that it can alert them so that if they want to take you somewhere or do something to you, people are already on alert and they can help you. So I thought that this would be very cool, because if you have to go out at night alone, I always get so scared. Even though I live in a city that is a little bit more safe than other places in Latin America, I try not to go out much when it's dark and alone. So I think this would be very good for me and a lot of women, because they could like protect themselves, not alerting the attacker, and at the same time having like different aims of protection. The police, that maybe they wouldn't do anything, and or the people, maybe someone is considerate and would go find you and help you if the family member that you chose is not able to go there very fast. So yeah, even if they take you somewhere, they would have your location to go help you, or someone can see the attacker. And yes, this was like, it has a lot of background, a lot of devices they tried to develop before to safeguard women because of all the things, all the dangers that are among us. So that was my motivation, my field of interest in this topic.
Okay. Do you find about something about the process of registration and how will be, what year, from
All I know is
what
that this is
lawyer?
from
How
Australia.
was that? Mm-hmm.
I'm sorry, what I couldn't hear you just now. Can you repeat that to me?
Yeah, like what was the information that you find about the register process of this patent? How it works first, and where
Okay.
basically what year, other information that is also important to know it.
Yeah. Okay. So it was and I was trying to look for the most recent device and invention that I could get. I wanted something to be very new, very recent. So this is like 2021. In January, it was published, and yeah, there are like 4 or 5 inventors involved in it.
Mhm. Perfect. Now I want that you please tell me how is the process of register one patent in Bolivia, if you know how this works, and what is your opinion about it? Do you think that is in this moment maybe so far away of the technology and politicians, and how is working basically in your country?
Yeah, so we have all this stuff of IP on Senapi. You're probably familiar with it. And I tried once to file paperwork there, and I think the process is quite slow, especially because you have to huge amount of days, and you have to transfer all this information by written way, written por vía. ¿Cómo se dice vía? I'm sorry.
What do you want to say before and after? Before and after.
Tienen que pasarlo por los trámites por vía escrita. Son
Okay,
muchos requisitos.
you need to send all the requests um doing papers. Like you need to do paperwork, like by letters, or everything is paperwork, like judicial way. O
Yeah.
sea, via is way, but depending what you want to say in the context.
Okay. I get it. So I never filed a patent. I never knew what was the exact procedure for doing that. I just saw like small things for brand registration and copyright and all of that. But for what I saw, the only time that I was there is that you have to stay like waiting for they to give you attention or help you, give you information hours, and they don't like separate the topics that you need. It's like you have all the IP together in just one piece, and you have to wait like with a lot of people. So I think the paperwork could be faster. Probably that's the only thing I can tell you that I know of, because when it comes to register patents, I'm not sure I could give you like information.
Mm-hmm. No worries. I just want to know some of your information and how are you dealing with this area, with this matter. And the most important thing is learn how to manage this platform that will be so useful for lawyers. Also, because I'm so sure that you are involved with these patents and with this private law, it's important that you check the regional commissions or organizations that get related in these areas, because maybe you can find a job in one of them, like going to an internship or trying to go to one of these countries of CAN or Mercosur nations, and you can do
Yeah.
it like so easily.
No,
So maybe it
you're
can
right.
be a
It's
project for
quite
you.
interesting. I should know
Okay.
more about that to tell you. I just wasn't prepared for that. I'm sorry.
Don't worry. Don't worry. It's not an exam. It's just a conversation. Okay.
I think my
The
whole life is
next.
an exam from me to me. I'm sorry.
Sometimes we are so hard with ourselves, right? We
Yeah.
always want to have an standard, and life is
Yeah.
going quite different than our plans. We just need
Yeah.
to
Tell me about.
accept it. I read something really nice one day, and I want to share it with you. And it's our whole life in our whole lives we are always with the hope that the train of the opportunities didn't arrive yet. But the reality is like we trust to follow our intuition when the train is going in front of us, and we need to have the average and the power to jump in the right second for going in that opportunity, and then didn't live with a how will be if this happens, or with maybe, if maybe is the most horrible word in life. But also we need to live and create a life that make us feel that we jump in the train at the right time. So no matter what decision you take in your life, the important thing is how do you feel about that decision, because the other way
It's
will
just
never exist.
yeah.
But we always put pressure in the train that is coming and never in the train that we are right now. So
Yeah.
that happens to me sometimes when I feel you like talking, I need to do this. That is me. I have always something to do because I am an anxious person. I have
Yeah.
anxious. And
Me
if
too.
I'm not feeling that I'm not doing nothing, I start to feel stressed. And then I have to, it's like quite hard because
Yeah.
I have a lot of things to do. And then I start to, oh, I have a lot of things to do. But if I don't have nothing to do, I get stressed because I don't have nothing to do. So it's something important to realize and to understand how the anxious stuff works in our body and start to understand us and give us time to don't do nothing. For me, it's a really uncomfortable moment, and I start a process. Um, and I start for 5 minutes. Now I am in 15, where you clear your mind. That is really hard because how I am an anxious person, I start to overthinking everything. You don't have any idea. And I start to try to silence that, but it's like two opposites. It's like I try to silence sometimes and I try to listen. What is happening? What makes me feel worried about? To be a competent professional, have the job of my dreams, have my house. What are the kind of pressures that I am feeling? And just try to do it when you don't have nothing to do. Try to be in apart from the phones, from the computer, and ask yourself what is happening, what is my sensation, and try to give you peace. Okay, that is
Okay.
so useful.
Thank you.
And don't judge you. I judge you too much, and because you start to put your standard about your own life so high, and you start to compare it with people that can be inspiration for you, but from our system never will be inspiration. Will be you will start to compare with them, and can be a good 2 points, can be a failure or can be a success, but depend how you are doing the interpretation of following a goal. Because remember that in our lives we have personal issues that even if I have a huge house in front of the beach, maybe when I got it, I don't will feel realized because maybe I will see that I spent all my life working for that. That is something material. Or maybe we become a mom. We have a lot of circumstances. So the best advice that I can give you is don't judge yourself, don't put the standards so high, and enjoy what are you living. Enjoy the work, not enjoy the stress or accept the stress. Try to manage it. Try to see how it's not working with your
Okay.
behaviors, like with your daily behaviors. Because happens to me a lot in the office. I was always moaning like, oh, I have a lot of work and etc. But I start to see that I getting distracted so fast that I was, of course, that I was 5 hours in front of the computer, but that maybe 2 hours was doing other things. So I start to see my own, but not from the judge, and it's like, oh, Gali, always you are so lazy and you start to get distracted.
Yeah.
No, I start to see like, okay, Gali, I start to see that you like a lot of seeing Instagram. So we will give 40 minutes to see Instagram, and I sit and I enjoy my 40 minutes, and then for that 40 minutes I will work 3 hours continually, and then I will have other 40 minutes for see Instagram, and I start to control my brain. That is it's just an example, but it works with everything. And then that 5 hours I use it like with bonus, with words for myself. Okay, if you lose this suit today, you will go and have one big chocolate ice cream because you deserve it, because you are valuable, because you are so intelligent. Even when we have mistakes, it's not about ego, It's about how we see ourselves. Okay, amazing that you're having the job of your dreams, whatever, but I'm doing my way. And maybe in this moment I don't have the job of my dream, or my dream's job, but I will continue working on it. Sometimes it's not so important be the smartest or the fastest doing some things. The important thing is how I'm enjoying the process to become the professional that I want, to become the person that I want, to become the girlfriend that I want, to become the whatever that you want in your life. Because some people didn't want a couple, other people just want a lot of money, and that is good also. But we need to listen ourselves and understand what authentically we want. And that is really hard. It takes me years to understand what I want, and I am not so sure about it.
No, when I was your age, I had no idea. So I think you're going well.
We are young. We have like 10 years for taking decision, make mistakes, and learn from them.
Yeah.
So we always put a lot of pressure. So my advice tonight is, baby, don't put pressure on you. Just continue living your process.
Okay, I'll try. Yeah, I'm so used to doing that to myself. Nothing is ever good enough.
Yeah. Yeah. I know, because when I say it's like, it's me. No worries. Knock all the doors that you want, because the ones that are for you will open without pressure. Without pressure. That happens in relationships, that happens at job, that happens with money, that happens with opportunities. Always the door that is for you will open. Learn that. Always. And so don't try to force nothing. And if you don't feel uncomfortable in a place, thank you. Bye. That's
Yeah,
it.
yeah, that I can do. That I
Okay.
do. Thank God.
Perfect. Now we are going to next speaking call. That is, as you are seeing in your chat, a couple of options. I want that you read all of them and you choose one. And when you choose it, just let me know.
Okay. Okay, I have one.
Okay, which one?
No, I lost it. Offering an inappropriate prescription of medication.
Education. Perfect. Do you remember the activity that we had with migration?
Yeah, I couldn't forget.
We are going again. We are
Okay.
going again. This time with a lot of more of experience, of budget, of vocabulary, with a lot of skills that I hope that you learned. So my recommendation is, first, breathe deeply. Second, leave your device far away of you, then you will have free hands, and that will help with creativity. Second, everything that you want, just be secure about what you are saying. Put yourself in the paper that you want. And I was, in this case, what as a lawyer. And after that, I want.
I'm sorry, I couldn't hear you.
Hello.
It got just. I lost you. I lost you when you said. Yeah, no, I just lost you between what you were saying. I just couldn't hear you. I don't know if you can hear me. I think my internet is not great.
Yes, I can hear you. I was telling you that you need. You listen the part that I suggest that you use your hands. No.
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 Okay. So the idea is that you present an argument representing whatever case that you want. You can use the parts, you can use the proofs, the consequences, the facts, whatever that you want to explain in the order that you want. But so important that you try to talk about some proofs, try to talk about the request, the final request. What do you want? Money, and for what facts or reasons? For what concepts do you want that indemnization? And basically whatever part of the body, whoever that you want, however and whatever circumstances that you believe that is important for this case, that you just choose. So your time
Okay.
starts right now. From now you have 9 minutes. That is good time, and I am here for listen.
This is my closing argument, right? Like when the trial is ending and I have to have like a summer.
Ever that you want. And if you want to
Okay.
use some inspiration in the videos that you saw for this activity, the videos was just for that, for give you ideas, for give you perspective. So now manage and use it.
Okay. Yeah. Okay. So I'll start. Okay. After hearing all the arguments, all the witnesses, and everything that we have to analyze and study within this case of Adrian, a 9-year-old kid that has been brutally damaged with brain paralysis after he had a normal first months of life with his parents. We knew that they knew he had a few allergies, nothing big, allergic to nuts or eggs and just food, regular food. And they also saw he wasn't like other babies entirely. He had something that wasn't like developing in the rate that maybe it should, so they got worried. What parent wouldn't? So they take him to the clinic. They say, okay, we're going to find out something is wrong so that we can help our kid have the best life that he can get. And they do this. They take him to the hospital. They decide to practice brain resonance to him. And they sign the informed consent that the doctors are given to them so that the analysis can start. But something happens in that room. Something just doesn't go right. And according to the doctors that were there, including the anesthetist, anesthetist, I don't know. I'm sorry about that part.
Okay.
They say that his heart stopped for 30 seconds, almost nothing. But the brutal sequels begin. 3 months in hospitals, several analyses, meticulous studies that end up saying that most likely his heart was stopped for 10 minutes. Searching for the reasons why is just exhausting and stressful for the parents that just want their kid to be okay.
Mm-hmm.
So they say they come to the conclusion that he has suffered brain paralysis because of the drugs that the anesthetist supplied to him. How do you deal with that? After this, obviously, he becomes a special needs boy that has to have his parents with him in total and complete dedication because of something that a doctor did and that could have been avoided. How did this happen? So we have this medical negligence case. We need to prove that this has been caused because of a doctor that didn't take enough care of his patient. Even though in the informed consent there was explicit part about the allergies of Adrian regarding eggs and milk and nuts and all these things, they administered him with propofol and maxilin that contains less egg lecithin that provoked his issues, that provoked him not having the life that he should have and could have had. So we have to prove that I have to prove that there wasn't a standard of care on part of the doctor that supplied these medicines. What kind of a doctor is not going to take the bother and read the informed consent that the parents are signing, especially when it comes to a little baby that only had allergies? He didn't read it. He supplied the drugs that just came to his mind at first. This isn't just a matter of standard of care when it comes to doctors. It comes to a normal person that should have been completely focused on his job. He wasn't. So what happened? He breached the standard of care. He caused permanent damage to a baby that could have had a normal life. And after this, they tried to cover the thing of the brain paralysis, saying that he had a syndrome that would have caused some difficulties within his development. This wasn't, it's just not that simple. We have already taken all the experts' reports, all the genetic studies, and they show us that the problem that Adrian had and that showed when he was 2 years old is not the cause of his current brain paralysis. So he's applying the drugs, and this is the direct causation of the problems that this family has now. What are those costs? Besides money that they have to spend in therapy, multiple therapy, special education schools, the sacrifice, the total devotion that they had to have with his child so that he could be okay. What if something happens to his parents? What if they die? Who is going to take care of Adrian with that love and devotion? You have no idea what it takes to take care of a person that just cannot do things for himself. She's his mother. She gets tired, not because she's his mother, she's invincible and has to deal with this because it's her son. She does it with all the love of the world. But it's not fair because it could have been avoided if you could just read the informed consent that they were giving you signed. This kid cannot even eat like a person can. He has to have the nutrients injected to him within a button that he has on his stomach. He can't even do that because of what happened to him when he was just a baby, a small baby. So what are we asking? We are asking for compensation that can cover the therapy, the special things he needs, a wheelchair, a special family car so that they can take the wheelchair, the special education school that he has to go, the special injections that he needs to be completely fed. We are asking for that compensation and what it takes so that he can have the happiest life he can, because he is a happy kid. But he could have had much better life. His parents shouldn't be this tired. They shouldn't have this sacrificed life because of what a doctor did to them. So this is more than a medical negligence topic. This is a case. This is a human negligence case. This is not about I didn't know how to treat the patient. This is about I don't know how to read, if you excuse the anger. So we are asking a compensation of $1 million. Thank you.
I was talking alone because I don't have microphone on. Sorry. Okay, perfect. Until now, I want that just for yourself to try to find the first exercise that we get, and you find this one in YouTube and you do a comparison between the first one and the last one, because you will find a lot of surprises. Until now, you are the best one. You connect. I guess that you follow a lot of like way to do the stuff from the videos that I sent it for the activity of today. I saw structure, I saw balance, I saw arguments, and so how you connected your emotions and the people that is listening to you, and also call the attention, but also put it put in technical vocabulary inside of your speech, and doing a really heavy and strong conclusion. So congratulations for that. I do it from the bottom of my heart. And of course that you have 10 over 10. to do amazing, amazing. And sometimes I, that I am like quite moving here and moving here because I'm taking notes. I am doing some like no reports. I am putting scores online and checking that you don't owe me nothing. So I'm quite busy with the computer. But you caught my attention completely. And I just want to say congratulations because um, you are putting your standards so high and you are getting it. You are going for it. And I'm so sure that you can go for more, but from acceptance, not from judging yourself or trying to push and don't let you enjoy from your little awards. So this is one. This is one. You do it perfect. I wanted to listen to yourself. You sound so professional.
Oh my God, thank you so
I
much.
want that you have the opportunity to listen to yourself doing this
Okay.
kind of a speech. You
Okay, I
have
will.
angel is the way that say it in English. En español es como tienes una chispa, tienes que mirar muy bien si lo tuyo es el litigio, porque yo lo veo, no muchas personas, y claro, todas son buenísimas, y las personas que conocí en estos talleres son todas increíbles, pero pocas personas tienen ese bichito del litigio. Y como he estado en el litigio, te puedo decir que hay unas herramientas argumentativas que pocas personas la tienen, y de conectar muy bien con lo que sea que te estén pidiendo, pero de conectar rápido, porque no sabías que ibas a hacer esto hoy. Y esos ejercicios de improvisación son full para saber quién va al litigio y quién va a otras áreas que igual son valiosas, pero tomarlo como un consejo de alguien que ha vivido esa experiencia, que es muy linda, que agradezco porque ha creado lo que yo soy hoy, pero, pero mírate bien ese tema. Me gustó mucho, de
Oh,
verdad.
gracias. Muchas gracias, Gali.
Applause. And before you leave, I will please ask you that you fill the survey and have a nice weekend. Enjoy, don't do nothing, just rest, and I will see you the next week.
Okay, thank you so much.
Okay.
Have a nice weekend. Bye.
Bye bye. Daisy, hello, good night.
Hi, Gali. Good night.
I'm having bad connection. Daisy, are you here?
Yes, I'm here. Can you hear me?
Hello.
Hi.
Yes, I can hear you. I am having today some connection issues. So if at some point I freeze, like my image gets freezing, just let me know and I will stop and try to connect it. I am the closest that I can to the Wi-Fi router, but I don't know, it's just not working today. If at some point I just turn the camera off, it's because I am trying to help in the signal to going forward. Daisy, you owe me some speaking calls. I want to check it.
Yeah, is it about bad lawyering?
Yes. Yes,
Yeah.
okay. Do you have the information for doing questions?
Yes,
Do you
I read
remember?
the article when you send them, but I mean when you send it, I read it and I wrote the ideas and I still having this road. This road.
Okay. So tell me, what is the road that you're having or the notes, and how are the ideas about lawyering? From the things that you tell me, I will create the questions for you.
Okay. When I read the article,
I will turn off the camera right now. I am here. I will listen to everything and you will listen, but
yes, it's okay.
I have an advice all time, like your internet is, so continue.
So bad lawyering for the article is like an ineffective assistant of a lawyer in counsel or in a big percent of people. For example, a big percent of people doesn't deal this crime, and these people go to the jail because they didn't have an effective defendant. And I have never heard about the sixth amendment. I just hear about the fifth amendment, but the sixth amendment is about or means that everyone should have a good lawyer with a good defense when he's accused for some crime, and the prosecution has to find the truth and the defense have to do nothing, even though the defendant is not required to present witness or evidence in the prosecution. But many people that is innocent and they prefer not present witness or some evidence, and many times that this happens, um, the Jew take the defendant silence like a culpability. Okay, se salió. Eh, eh, eh. This is the remix.
Hello.
Hi.
Oh, the last thing that I listened
Yeah.
was about the witness out of Zoom. Can you listen to me?
No,
Hello?
I can understand you.
Peter hates me tonight.
Doesn't matter.
I will try to other position that will help to the connection. Maybe I am hello.
Hi, Gali. I'm here.
You listen?
Yes, I can listen you.
Now you listen, can you hear me?
Yes, I got it.
Now perfect? You are listening
Yeah.
perfect?
Yeah.
Yes, okay. I will turn off the camera because I am
Yes, it's okay. It's okay.
perfect. Telling me you were telling me about you were, oh come on, Gali. You were telling me about the witnesses, and then the connection goes down.
So I will continue. So a person that is innocent but
Continue.
is in a prosecution, the 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 client um, the client can present evidence or a witness, but if the client don't want to do it, it is in the right to don't present it. But many times when it happens, the jury take the defendant's silence like a culpability, and this is bad because it supposes that a judge, the a judge, uh, have to be in a half point to don't wield the people or presume innocence. So in many cases of bad lawyering are because they don't have a good communication with the client, because the lawyer thinks that the client is wield, so they don't do a good job because maybe they are a public lawyer and many times they have many works to do. Um, Many times the lawyer don't want to discover the truth, and they do a minimal preparation for for the litigation for the clients. And also there is an appellant that is in charge to prove that the law did a good job and the defendant and has a good choice, so that it is department to in charge to prove that the lawyer did a good job. And many times for this department of these kind of people that their work is prove that the lawyer did a good job, many times people is saved from the death sentence because they have about lawyering, but for this department they can notice about that and save these people for the jail when they were innocent. And also many times people will to the public lawyer for doing a bad defense because they are not good paid or they have a lot of work. But there are many bad lawyers in a private sector too, not just in a public sector, because it is so common to think that the public sector of lawyers they do a bad job because they don't have a good payment or they have a lot of work. But in the private sector are bad lawyering too. And maybe the people who hire a lawyer or a defendant is looking for a lawyer, but they think or they look in the internet and they think that a lawyer that is hated for many people, this is the most hated for people, is a good lawyer. This is a bad idea because many times this kind of lawyer can be really bad lawyers, not just because many people hate it. It means that it's a good lawyer. So this is about that I understand about bad lawyering. That is the when people do bad the work to defend to another people. So that.
Okay, perfect. I completely understand your point of view, and I really like how you talk and you discuss these topics because you look like a lawyer and you're starting your career. So for me, it's like, okay, Daisy, we will start to move into our next speaking call, that is the medical negligence. Okay, so
Yes.
the first thing that I want to ask you is 1 second. Give me a second. That I'm how this chat goes wrong. because turn off, the chat was deleted. So give me a second.
Okay.
Restore it. Remember the session that we had of migration law? Like the improvisation session that we get?
Mm-hmm. Yeah.
Okay, perfect. So I want that I will tell you, I got it like written, but actually all the subjects were deleted, so I will tell you. I want that you choose one of these three topics. First one, like a medical proceeding, like a bad medical proceeding. Then you can talk about a posology or a bad receipt that one of the doctors gave to somebody else. But also you can discuss about any mistake in the post medication, right? Or in the post surgery. One kind of the medical negligence more common is the one where the doctor leaves some object inside of the body. And this is so common. I'm trying to find the list. A second. I know I just lose it. So choose one. Choose one of these cases. What do you prefer?
Can you repeat
Either
it,
one of
please?
the options that I just gave you. Yes, you can choose about one. Give me a second. I am trying to find it because it's easier. No, this not. It's so sad. Okay, you can discuss about one mistake by the medical health or medical insurance giving you a bad receipt of about one mistake in the pathology or one mistake in a surgery. Other or a mistake in the diagnosis that, for example, I tell you that you have cancer and the real thing that you had in your body was, I don't know, something like a virus or a bacteria. Okay,
I
so choose one
was
of these four cases.
about diagnostic. I don't know.
Bad diagnosis.
Diagnosis.
Okay, perfect. So I want that we do the same process of of improvisation. I want that you create an history that you are representing one of these victims, that you case in front of the judge or in front of the jury, and what things you can say about it. Like how you will manage, how you will defend the victim of a bad proceeding or a medical bad proceeding or negligence in this case. And your time start now. I will turn off the camera because it's really bad, my connection.
Okay. So I'm representing to Rosa Martinez, and she is a woman that believe in the diagnostic of a doctor, of Dr. Perez, And in the first instance, Rosa feel in her body tired. She she felt tired every day. She had headache. She had a stomach ache, and she felt very very bad. And she went to the doctor, and the doctor when the doctor sees saw Rosita, he just say, "Oh, you have maybe you are maybe you're a woman that has COVID-19, 99." And started to treat to Rosa with COVID, and the doctor sent to Rosa at home and recommended to stay at home for 2 weeks, uh, for see if she is a people who can transmit the virus. But then when Rosa was at home, she felt worse, and she starts to have throw out. She starts to have more headache, more stomach ache, more symptoms, and she say no, it's not COVID. And she went another time when Doctor Perez, and doctor say, okay, we will do some exams, and they they did the exams, and then the doctor say, so you didn't have COVID, now you have um a cancer in your stomach ache, and we have to operate.
No worries, just continue. This is the list that I was trying to looking for because it was lost when the call closed unexpected way. So continue. You are doing so good.
Okay, so when the doctor said that Rosa had a cancer in her stomach ache, he said that a surgery was required, and Rosa accept because he trusts in this doctor. He trusts that the doctor has a big career, a big experience in the hospital. So she believed in the doctor, and she say, okay, I love my life. I want to save my life. So I want to be surgery. And when the days after the surgery, she said, I need a second opinion. So she comment her case with a friend, and the friend said that she have a friend that is a doctor, and they meet, and the another doctor did new exams, and they say that he said that Rosa doesn't have cancer. I don't know how do you say hernia. I don't know how to say it, but she had this. And
Hernia.
Yeah.
Es una palabra súper complicada. No, la verdad, no sé. A ver, déjame un segundo. ¿Buscamos? Salimos de dudas. De una vez buscamos cómo sería decir hernia. Hernia. Hernia.
Hernia, okay. So then the doctor friend
rupture.
say that Rosa.
Como
Yeah, so the
ruptura.
doctor friend said that Rosa didn't have a cancer. She had a hernia in her stomach, and she needed a surgery, obviously, to extirp the hernia, but not in the place that the doctor have said that it was the cancer. So when she got to the when she went to the doctor again to say him that the diagnosis was wrong, that she she never had a cancer. The doctor retract herself that about he was saying. So this is a bad diagnosis that we can see here, and my client lose money in exam, lose money in transportation, lose money for the quarantine that she did at home for recommendation of the doctor. When in the first time the doctor said that Rosa had COVID, and she lost a lot of money for following the diagnosis that this doctor did. And then my client Rosa was my client a few days after before the surgery. She decided to have a second opinion, but if my client didn't want to do this second opinion with new exam with a new doctor, she will do this surgery, a bad surgery, because it was a bad diagnosis. So she will be maybe die because she didn't have cancer. She had a hernia. So this doctor, if my client didn't go, have never gone to this new doctor, my client maybe will die because they will be receive a surgery with a cancer, and she didn't have cancer. And bad this is a bad diagnostic the part of from this doctor. And this doctor had a lot of experience in the hospital. This doctor, he had many clients, many patients. And how many times this is the first time that we can detect that he did a bad diagnostic. But how many times, if he did it one time now, he did it a lot of time in the past, and how many times he did a bad diagnostic, and uh, can deal, I mean, this doctor can could deal a bad diagnostic to another patient, and this other patient can lose money buying medicine that never worked in them because they didn't have these issues, they have another illness. So i was I was begging for, I don't know, $500,000 for my client for I for cover the loss of money that my client had, and for the church that my client had to pass, because my client was a few days to receive a bad surgery in her body, and he lost money in all of this. He paid for the surgery, he paid for a diagnosis, for medicine, for everything. So uh, I'm I'm defending my client for a bad diagnosis that she had. I don't know. Just that.
Perfect. How much money are you asking for compensation?
What? Didn't.
Sorry, how much money are you asking for compensation?
I'm asking for $500. No, $500,000.
Thousand?
Yeah.
5,000? 5,000?
Yeah. Yeah.
Okay, thank you so much. Okay, Daisy, you do it so good. You look like a lawyer. You do it perfect. I really like it. Having accounts that you're not seeing any kind of preparation for these kind of exercises and you are not even starting your career, you do it really, really good. So congratulations for that. All the error in the diagnosis of the patients was a really good story. And you use all your creativity. So congratulations for that. So
Thanks.
for now, we are done with our speaking calls and with the speaking calls that you owe me. I will just have a double check it this weekend that we'll have a lot of free time. And I will see you then next week. Thank you so much for your time. Before you leave, I will please ask you that you fill the survey.
Yes, I did it.
And yeah, thank you so much. Sleep well and have a good weekend.
Good night. Thank you.
Good night. Thanks. Laleska, hello. Good night. How are you?
Hi, Gali. Do I need to turn on my camera because I am on a class right now that it's not an importance. It's ending, but the thing is that my internet is kind of like not very well, and I don't know if it can handle both of them.
No worries. No worries that I am in the same situation. My internet is so shitty today and it isn't working. But the idea basically is that we have the opportunity to do an improvisation case again. I am so sure that you remember the case of this migration.
Yeah.
Remember the improvisation that we get? Here will be the same. I want that you create a history, a part in front of the judge, in front of the jury, with any situation that you want, any cause or circumstance that you want to create. Following one of these points, I will send you in the chat of Zoom. You can choose delay or error in the diagnosis of a patient, not following certain protocols, offering an inappropriate prescription of medication, perform a surgical intervention with harmful results for the patient, contamination of a serious infection due to the lack of hygiene hospital center, forgetting surgical material inside of the patient, failure to provide emergency health care, lack of post-operative supervision. You can choose one of these topics and basically create the case that you want, support with the proof that you want, and everything is about your creativity. And please don't forget the ask for the compensation. And yeah, that's it. So your time starts right now. I am listening.
Kind of thinking about what kind of scenario they want to play on. Okay, I think I have something.
Okay. Which topic do you want to work tonight?
Failure to provide emergency healthcare.
Okay, perfect. I will try to turn on my camera, and if it didn't work, so we have some connection issues, I will turn it off.
Okay, that's fine.
So you're listening and seeing. No worries.
Because I'm in my phone trying to do this. Okay, I think I have something. Good night, Judge. Today I'm here representing my client, Juana Lopez Castro. She was a victim of a medical malpractice by the doctor named Juan Paredes from the clinic Los Santos, located here in Lima, Peru. And that and the event happened 2 weeks ago on a very tragic night where my client, due to the exposure to the virus of COVID-19 that has hit us very hard in our country, she is a medical professional herself. She has to deal with a lot of patients around COVID-19. She works right now in an administrative side of the field, but she's really exposed to it, and she had very little symptoms at the beginning of the contagious disease state of COVID-19. However, March 3rd, 2021, she had a multiple organ failure due to this virus. She was quickly and promptly taken to this clinic, Los Santos, by her 13-year-old daughter that was in a really, really hysterical and emotional state, because she being so young and finding her mother in this kind of states in her sleep was really terrifying for her. When she arrived to the premises of this clinic, the first and the upfront reaction from the personnel of this place was deny her entrance. They made a patient that had multiple organ failure to stay outside of the premises in the really hot and very, very dangerous outside of the premises where anything could have happened to her, alone with a 13-year-old in a very, very, very emotional state, and constantly refused her to even explain what happened, to even given the little healthcare or a standard of care that is expected from a clinic. Let's note, it's important to highlight that my client has healthcare cover in this clinic, so there was no reason whatsoever so that she doesn't receive a prompt service from these healthcare workers. She spent around 30 minutes outside with no help, with multiple organ failure. And when she was taken inside of the premises after some of the healthcare workers actually review her case and her state as someone that was that had insurance in that clinic, she was put in a waiting list for around an hour of horrible emotional state, not only for her relatives, but for herself. It was really horrible to see and to watch, because even in the recordings of the premises that we have shown to you during this trial, it's shown that no one was looking at her, no one even glanced at her, no one even took her pressure, no one took her temperature, no one even checked with her daughter what happened, what were the hours before, what her state was the hours before she arrived to the premises. No one cared for her. No one cared for her, despite her being a person that is insured by this clinic. This obviously led to the death of my client, and who's to her death in a very horrible and very horrible and emotionally traumatic for her daughter and her relatives, who are the ones that are behind this lawsuit. We have proven in the trial that all the standards of care that are reasonably expected from healthcare workers in a competent way were crossed. They breached that standard of care. They didn't respect it. They didn't do what was expected from them, what they're bound to do when they even receive themselves as health workers. They have a duty with people, insurance or not insurance, whatever their nationality is, they are bound to attend this kind of people. It's really important to note here that there was no problems with payment. There was no problems with not wanting to pay or not wanting to pay for the cares. We understood that payments were going to be made and we had to do them, but the clinic refused to still attend this kind of people, my client. This breach of the standard of care was the one that ultimately caused the injury done to my client that was death, and the traumatic repercussions that it had on her relatives, especially on the minor that had to testify all of it, and that is here being brave and trying to give her testimony to support this case. This obviously means damages directly to the family that have to face all the fees and the costs that they are still given to them. They say that they owe them, the hospital says that they owe them $30,000 in care that was clearly not provided to the client, that was clearly not given, because in the evidence you can see that they don't even wasted a piece of paper on my client. And there's also the emotional harm that was made to her minor children, the child, 13-year-old child, that doesn't have any equivalent in money that we can set here, but that is surely something that will accompany her all her life, and that no one will take ever again. Those last hours and those very traumatic memories that she will always hold within her heart are not something that they can ever change. And for that, we are looking for a compensation of $300,000, not only for and that all the charges are revoked, that there is not these $30,000 charges made to the family of my client or to her children or closest relatives. And as I said, the $300,000 on damages. Thank you.
Perfect. I love your intervention. You give all the structure and you follow all the speech like with a lot of you just focus in the things that you need to emphasize, but always following a rule of argumentation. And by the end, just I feel you a little bit aggressive in the way that you check the argument. Like, didn't spend a piece of paper on my client, and is the way that you can see the personality of each lawyer that is so useful, because of course that we have different ways to go in every situation, but you do it so perfect. Thank you so much for your time, and I will see you in the next week. I will tell you the schedules because the direction is giving me other orders for following this last session, because we are close to restart a new course. So I will keep you updated on WhatsApp, and thank you so much for your time to do it perfect. And you know that it's 10/10 as always.
Thank you.
Okay, thank you so much. Have a good night and nice weekend. Before you leave, I will please ask you that you fill the survey, and then we are done.
Okay. Okay, I sent it.
Okay, thank you so much. I hope you
Thank
have a nice night. Bye-bye. Thank you. Karen, hello, how are you?
Hi, Gali. Fine, and you?
I am so good, but as always, I'm having connection issues because I am having a lot of people in the hostel. And
Okay.
oh my God, I guess that we are a lot of people connected. So tonight, you don't owe me nothing, right? We are having like all speaking calls done.
I missed one from with the topic of agrarian law, about the problem in our country about something. I missed that call.
Do you have the date?
I don't remember. I think what's the day that you tried to contact to me to
Yes, perfect.
to
I have
find
it. I have
me
it.
earlier, but I didn't wasn't available. So,
Yeah, perfect, perfect, perfect. I got it. I got it.
but it was,
March 3.
yeah, it was about agrarian law, and I don't remember missed anything else.
Okay, perfect. So we will put all this information here. So I will send you this weekend when we can fix this, like when we can do the session. But thank you so much because I didn't take notes about it. So I feel so happy. And okay, so for today, I will please ask you that you select one of these situations and that you tell me which one did you choose. I
Okay.
just send it in the chat. Please let me know if you are just seeing it.
Okay. Okay. I would like to take the the option that said not following certain protocols, I think, or offering an inappropriate prescription of.
Okay.
I think they're not following certain protocols.
Okay. Okay, perfect. So we are going on it. Do you remember the activity that we had about migration law that was a kind of creation of a case and you will try to defend it behind a whole creativity process on you? You can put whatever that you want, whoever that you want, any situation,
Mhm.
circumstance, case, part of the body, clinical stuff, and the proof that you want to create. And also the most important part is the conclusion and the compensation that you are asking for to the trial or to the judge or to the jury for
Mhm.
follow the interest of your client. So in this order of ideas, your time start right now, and
Okay.
I am listening. I'm completely listening.
Okay. Your Honor, we are here today to discuss or offer conclusions about the case of Catherine Legal and about how medical ne- negligence, um, extinct
Negligence.
negligence. Thank you.
Es, es re
Medical
difícil esa palabra.
yes.
Negligence, yes.
Medical negligence finish with our her expectations in life. First of all, I have to take uh, in my discourse all of the evidence that we have in the case because there are very relevant to arrive to conclusion of this case. And first, we have to comment about the technical inform that we saw 1 week ago when we interview the Mr. Hawking. He is an expert in general surgery, and he reviewed everything in the medical file. So at this point, I have to notice or to point. I have to point that he arrives to a general clause that it was an big medical negligence in his case. So, as you remember, Catherine Hill um, arrives to hospital in February 15 to be to get attention about a pain that she has in his feet. And at that time, Dr. Connelly, Dr. Connelly provide to her uh, medical cares and talk about the possibility that she has a bacteria in his finger. He told her that it was recommended easy procedure to extract that, and she had to take um, some pills for 2 weeks. Just just that. Anything else, anything risk or damage was alert to the patient, and she decided to be in that procedure. While the Dr. Connelly was doing practicing that procedure, he um, said that he had followed um, the protocols that were established to bacteria treatment in foot and feet. And, and the patient, Catherine, um, in February 17, after that procedure, um, she wasn't feeling well. So she decided to call the Dr. Connelly, and talk with him to some um, how I say some problems that she was experiencing in her skin, and some signals of infection in his finger. Actually, it was increasing her infection. Dr. Connolly um, uh, told her that sent that picture, and when he uh, watched that picture, he immediately called back her and told to drive faster as she can to hospital. When she arrives again in February 17, he explains to her that the treatment wasn't working fine. So she asks him what was the reason about that, and he just limit his discourse to said that he didn't know anything about what's happening, because in his theory there everything was to works fine. So he intend the patient in the hospital, and decided to apply another protocol. This protocol was an experimental protocol that was not approved by the national um, administrative medical office in charge of this kind of administrative approvals. And the most important um, situation or violation of Catherine's rights was um, at this point was being done by the doctor when he applies these protocols, experimental protocols on her. So as a result, she lose her feet, and right now she finish with everything dreams and career in athletics because she was part of a university team.
You,
And
I listen. Sorry. I listen
yeah,
until athleticism.
mhm,
What do you say after?
athleticism. She was part of a university team. Or
Yeah, continue.
okay, so Your Honor, these violations of medical law and human rights of my patient, especially in her right to be informed about anything that impacts her health, was proved with the inform that gave to us the expert last week. Also, we have proofs, the receipts when she paid the truth procedures, and later when she was in hospital around 1 week. There are also receipts that prove what happened on them. We received also the declaration of nurse Marianne Hawking that and with that we demonstrate that Dr. Conley did these faults to procedures. And about the moral damage, we have proofs with their family declarations, actually the kids' declarations and her parents that proves how she was suffering and how she continued to be suffering. So in this case, we claim a compensation around that we estimate in the in $20,000 to cover the suffering of Catherine, and we demand also the payment of everything medical cost that she assumed for these procedures and that are for an amount of $50,000. The two claims are total of 70,000 dollars. And finally, we claim the lawyers' payment that it's around $10,000. And with that, I close my conclusion discourse. Thank you.
Creativity, you use also some English names for the doctors and nurses. That is quite interesting because your brain's having time to create the whole story. But also you close really good your argument to ask for the money that you want and you ask for the money of the lawyer, and that is so important. You are the first one that came for your salary. And yeah, so thank you so much for share this activity with me. Sleep well, rest, have a really nice weekend. And before you leave, I will please ask you that you fill the survey, and I will see you the next week.
Okay.
I will tell you when we will work in the sessions that we have missing. Just let me, I will organize everything this weekend, and I will keep you updated about it. Okay?
Okay, thank you so much.
Did you feel it already?
Yeah.
Karen, did you feel it, the survey?
Yes, I feel it some minutes ago.
Okay, thank you so much for your time. Sleep well.
Bye.
Bye bye. Bye. Chris, yeah, I am having troubles with internet tonight. So the connection is really bad. If for some reason you cannot listen, just tell me because we are having like a lot of people in this time is connected to the Wi-Fi and it's so weak. So I will turn off the camera. That always helps. Today I have two sessions with you. Okay, we are having like environmental law and medical negligence. So the first one will be like the environmental law. I want that you please tell me what do you have in mind? What is the topic that you choose for discuss tonight? Why do you think that is so important or relevant? Tell me all the context and all the things that you want to share with me.
I choose the topic loss of biodiversity. And wait, Kali. Okay. Uh, I want to choose this topic because it's interesting for me. And I choose two articles, and I can read the article or no. Oh,
No, no, tell me again. I cannot listen the last part.
I can read the article and explain
Oh.
my proposed for put the this article.
Yes, you can listen. You can read it if you want, but I want that you tell me that like your opinion as a conversation because by the end of the day I will read your article for giving you the feedback soon. So no worries at all. Just let me know your point of view. Let me know what is important and why did you choose this topic.
Okay, I choose this topic because the article mean that the animals and the different damage for the animals. The article is say every animal belonging on the wild species has the right to live freely in its own natural terrestrial, aerial, or aquatic environment and they reproduce. And I think it's very interesting topic. For example, when the people go to the zoo or yes, the zoo, say that I listen that the people say this animal can como que debería vivir in, in, en el hábitat que ellos nacieron, por decirlo así.
Yes.
But
So this animal should live in her or his native environment or natural environment.
okay,
So this animal should live on his environmental
okay,
yeah or his native environmental or natural environment.
should. What is the meaning of should?
Should así debería.
Mm,
Así se escribe. Should. Sí, should.
should.
Y no debería es shouldn't.
Should.
O
Yes,
should
I
not, que es lo que
listen
significa.
it different.
Should.
And I don't understand the
Okay.
pronunciation. Sorry. And and this the people say this, and I think that the animal live in cautiverio, se podría decir. No, no sé
Yes,
cómo se
without freedom. Yes, or
freedom.
captivity. Yeah, you can say without freedom, que es como sin libertad. Without,
Without freedom.
without freedom, así. Freedom.
Or
Or
freedom.
in jail, that is more specific.
Okay.
Que es como encarcelados. On jail, like this.
Okay, on jail. And this I think that is difficult for the animal how sorry like uh, feel good in the natural habitat because the animal live all life in on hail. For example, the animals that
On
stay
jail, jail,
on
jail.
jail, the animals stay in el circo, salveado circo,
Circus.
circus, and
Yes, circus.
they can live in the natural in the natural habitat. And this,
Yeah, in his, así, mira. Check the WhatsApp.
okay,
Their natural environment. The natural environment.
in the
There, because es un posesivo, ¿no?
sí, sí, sí.
Entonces le pertenece como a su ambiente. Okay,
Eh,
continue.
and this I don't understand. Well, the people don't understand this point that the animals live in the environment and in their natural environment.
In yes, perfect.
They can that that because they can live a lot of time in this area. Don't survive, I think that's same.
Yes, don't survive. Survive.
Survive and don't survive. And the second article say any act that involves the death of a large number of wild animals is genocide. That is a crime.
Wild. Wild.
Wild,
Wild.
wild. The speak
Wild. Perfect. Wild es wild. Como si fuera una A.
wild. Okay, okay. And I think it's a link because there have uh, cases in which circumstance or and circus, circus, yes or no,
Circus. Yes.
circus,
Perfect.
uh,
Perfect.
or zoos have give animals to kill them and use their skin of the clothes or
Yeah.
these things. And some organizations have made sure that this stop happening, but the people, the government don't 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 do anything. I think no hace nada. ¿Cómo sería ahí? Or nothing.
Sorry, the government. I have like internet
No, no.
issues. I'm having troubles. My connection is so bad.
Que el gobierno no hace nada. ¿Cómo sería?
Mm-hmm.
The government don't
Then government don't do nothing. Yeah.
nothing. Yes. And this I think.
Okay. So you are agree with the existence of circus?
Mm-hmm. ¿Cómo?
¿Estás de acuerdo con la existencia de circos? Are you agree with the existence of circus?
Yes and no. I think that the circus can do different things. For example, the 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 club or this situation, but uses the animals. I don't agree.
Okay, perfect. And what do you think that the government should do with the animals that now are on jail or that didn't have any freedom? What do you think that should do the government with all these animals?
I don't know. I think that it is terrible to do this because I think that the animals have a stay in their environment uh, habitat and natural in their natural environment. Sorry.
Natural environment.
Yes.
Muy bien, but also if you say habitat, is also right. Está bien si dices habitat.
Okay. And I think
Okay.
that it's bad for the animals.
Okay, perfect. Perfect. Other important thing in this case is like the last question is, what do you think that is the relationship between law and between all these environmental problems that we have?
I think that it's situation that pass in the world and the people some people think that is bad, but some people that think that is good. I think that is the circles or sos ya que existen, ya que hacen eso. I think that
Now that exist,
now that exist,
that they
I think
exist, how they exist, yeah.
I think that I don't know that give all other people and the other people, for example, uh, some sauce. Eh, ¿Cómo sería ahí para decir vender? ¿Sería la misma palabra o cómo?
Sell,
Sell, sell, sell,
sell,
sell,
yeah.
sell, sell a people famous the animals, and I understand that the animals all the time, all their life, live on jail, but it's a complicated topic, pardon, because
It's a really
the
complex topic. You will say like this. It's a complex topic.
it's a complex topic, and I don't know.
Hmm?
The some people
Okay.
don't. The government don't do nothing. And
Okay. Perfect. Other thing that is really important in this case is to like it's the conscience that we get about any topic in this law world. We need to understand how the things works, and we need to know that our paper of society is really important to continue helping to solve these issues or these problems or these troubles. Okay, now we are done with our environmental law speaking call. Now we are going to the last one, that is the one related with medical proceedings. So do you remember the time that we do an improvisation exercise with migration law?
Mm,
Did you
yes.
remember the time that we improvised? Perfect. Today we will do an improvisation process again. I want that you create a whole story with your creativity, with the parts that you want, with the case that you want, with all the facts that can happen will becomes from your mind. You are free to create any structure that you want in your mind. And the idea of this is like, are you seeing the chat on Zoom? You send that I send you a couple of things. The idea is that you choose one of these ones. Delay or error in the diagnosis of a patient, not following certain protocols, offering an inappropriate prescription of medication, perform a surgical intervention with harmful results for the patient, contamination of a serious infection due to a lack of a hygiene in the hospital center, forgetting surgical material inside a patient, failure to provide emergency health care, or lack or to post-operate supervision. So you need to choose one of these cases, and you after that you will create the whole story from this selection.
I have a question.
Tell me.
The not following certain protocols es como que no siguió los protocolos o algo así, o incumplió los protocolos.
Sí, no siguió como los protocolos correspondientes o ciertos protocolos.
Okay.
¿Cuál quieres escoger de estas posibilidades para sustentar tu caso?
Creo que esa, porque es la más general, siento.
Okay, so your time starts right now. I am listening to your intervention.
Ok. Tengo que contarle la historia de cuando cometió el error y como por qué casos no tendría que ser como encarcelada, por decirlo así, o encarcelado.
Yes, like what is the reason? How is this happening?
Okay.
And what is the money that do you want? Imagine that you are the lawyer of someone that are dealing with this case. And how much money do you want for solve this problem?
Ah,
O sea, la idea es que tú improvises que tú estás representando a la víctima de uno de estos procedimientos, que puede ser como un error en el diagnóstico, no seguir los protocolos, ofrecer una mala prescripción médica,
no, yo me
hacer
estoy
una
haciendo otra historia en
intervención
la cabeza.
quirúrgica. Hacer una intervención quirúrgica con daños para el paciente, contaminar al paciente por una seria infección, por un error de higiene en el hospital, olvidar algún material médico adentro del cuerpo del paciente, que eso es súper común, y como algún fallo en la provisión de una atención de emergencia en caso de emergencia. Y el último es como un descuido o un error en el proceso de supervisión del postoperatorio, que es lo que pasa después de que te operan.
Creo que entonces voy a tomar la de contamination of a serious infection to a lack of hygiene in the hospital center, I think. Ok. Cuento la historia, ¿verdad?
Okay, I'm listening to you.
Okay. When no sé cómo empezar, me pongo nerviosa. Okay.
No, don't worry. This is just a process, and I am listening to you. And no worries, it's not an exam, it's just a practice.
When my client they do the process of the, ¿cómo se dice cirugía? Perdón.
Surgery.
surgery,
Surgery.
surgery,
Perfect.
and surgery, and the doctor don't saw that he have roto hurt de guante, ¿cómo se dice?
Tell me, sorry.
¿Cómo se dice
I
guante?
cannot. Want glove. Glove.
Glove. Hurt glove. And in the moment that past this, uh, the doctor don't see that contaminate my client, and my client have a bacteria, or I don't know how do you say bacteria.
Bacteria is perfect.
Bacteria.
Perfect. Bacteria.
The bacteria. And my client want seven $1,000 because the bacteria affect uh, her organism, and this I don't know how to say. I'm nervous.
Okay, imagine that you are the lawyer. No worries. Imagine that you are the lawyer of this case. How much money do you want for that damages?
No, no te entendí, Gali, se cortó.
Imagine that you are the lawyer of this case. How much money do you want for the damages?
Mm, $1 million, I think, because she have buy the vitamins, the pastillas,
Pills,
pill,
pills, así se escribe.
pill,
Mira, mira nuestro chat. P,
PILL,
P, sí, muy bien. Pills. Perfecto.
and she buy the pills and vitamins and these things that she can recuperate. Yes, I think recuperate.
Recovery? No.
Recuperate.
Recovery.
Recovery. And, and this, I think.
Okay. What was your favorite part in the videos that I sent to the group?
The first video. The first video.
Why? What was your favorite? Why?
Because I like the louder stay secure, and I don't know, give me no sé, como que mostraba seguridad en él cuando hablaba, cómo se expresaba, and I think that the technique that
Because he shows.
Mhm.
Because he shows
he shows cute
security,
uh, security.
and she has a technique. She has
He has a technique that de ¿cómo se pronunciaba la palabra jurados?
a technique.
Jury.
Jari. Jari.
And
Se escribe así. Perfect.
and he tried that the jury commovate for the situation and think that take a better decision for uh, the life, sorry, and the child and the man, the man, because I understand that the wife of the man death in in the moment that cuando estaba teniendo al bebé. No sé cómo sería ahí.
Yes. No, it's perfect. It's perfect. Um, I like that you have your own perspective and you start to see how these lawyers works in real life. It's so important that you see how is the context.
Yes, and I think that is so important to to como atrapar al jurado, por decirlo así. No sé cómo sería ahí.
Catch the jury.
Catch
Catch the jury. Así. Catch the jury.
the jury.
Uh-huh.
To catch the jury.
Yes, that is the key. That is the key of a successful trial because you need to understand that people are humans and they have feelings, and if you can connect with them in one of these cases, you can have a lot of advantage from the other lawyer. It's the way that you need to afford it, and of course that is a completely new world for you because you are starting your career. But by the end, when you are finished, you will understand all the skills and all the techniques that you want to create, that you have to create meanwhile you are becoming a lawyer. So no worries, it's just time. And it's normal that you feel quite anxious and nervous when you are talking about a new topic. But it's normal and you are doing with a lot of creativity. And I want to tell you, congratulations. You are doing so good. We are so close to finish. This weekend I will organize all the speaking calls and see who owe me what. And by the next session, I will tell you and keep you updated about how we will manage it. But we are so close to close this chapter. So continue working on you and your speech and in all your proceedings for become a really good lawyer. I send you a big hug. We are done for the activity of today. And I will ask you that please before you leave, you fill the survey and then enjoy your weekend.
Ya respondí la encuesta.
Thank you so much. So enjoy your weekend and I will see you soon.
What's your name?
Igual.
Okay, bye bye.